Yes, I'm gonna. They muted everybody on the meeting. Some of the folks was arguing. So they muted everybody. They said that the meeting is being recorded.
Hi, good morning. Can y'all hear me?
Yes, sir.
Yes.
Yes.
That's why I don't know who I am. There.
Hey, Kim Clark, if you can hear me, can you give me a thumbs up?
Excuse
All
me.
right, good deal. Good deal. Thank you. Okay, we're going to get started in just a moment.
Good morning.
Good morning.
Where's Angela?
She's right over there. Well, VIPs are up front, so. Okay, we'll go ahead and get started. Good morning, everybody. Crystal, will you do another sound check? Can they hear me okay? Everybody can hear me okay? Okay, good deal. All right, so everybody, welcome to our Briarwood Resource and Referral location. I want to thank you all for making the time to be here this morning. Some of our advisory council members, they were not able to make it in person, so they will be participating virtually. Just as a reminder, this session is being recorded, and the recording of this session will be posted on our website as well as Department of Health's website. Okay. This is a public meeting, so we do have our advisory council members present. We do have some staff from Department of Human Services and Department of Health also present. And then we did open it up, so members of the public are going to participate as well. Okay. Just as a reminder, during the main course of the meeting, comments and questions are going to be reserved for advisory council members. Okay. So during the course of the meeting, as I'm doing the presentation, so those of you that are joining and that are members of the public and not a member of one of the advisory councils, our public comment section or session where we will take public comment, but during the main course of the meeting, we will just be taking questions and comments for the advisor from the advisory council. And y'all, that's just in the interest of time. Okay. We would be, I have a feeling we could be here today, tomorrow, Friday, if we were taking comments from the public and everything. But we will definitely give members of the public an opportunity to give comment on what they've heard and what was presented today. Okay. For those of you that do not know who I am Chad Allgood. I'm the director of the Division of Early Childhood Care and Development, and that is at the Mississippi Department of Human Services. Before we get started, I am going to ask the advisory council members if you will just introduce yourself, just tell us who you are. You can tell us where you're from, and then what your role is. If you own a child care program, if you're the director of a child care program, if you're a member of a support organization, if you'll just kind of give us a little bit of information about where you come from. So I'm going to start with the members that are present here, with us, and then we'll move to members that have joined us virtually. Okay, we'll start.
All right. My name is Carol Burnett. I'm with the Mississippi Low Income Child Care Initiative, and we're an organization that does advocacy to support the child care payment program.
And also tell us which of the two advisory councils you represent.
I'm on the Child Care Payment Program Advisory Council. And I just want to say, Chad, in light of the incredible financial crisis going on right now in childcare, it feels like the wrong topic to be.
So Carol, I'm going to stop you right there. I'm going to get into that, and I'm going to talk about that. But this is a project that cannot wait, and I'm going to talk about why it cannot wait. This is not. We're not going to be throwing anything new. I would ask that y'all just hear out the presentation before we get into comments about it not being the right time. Okay, I do understand, and just hear me out first. That's all I ask. Just hear me out before y'all make a judgment about whether or not this is the right or wrong time to do this. Okay, I think what we're going to present, you're going to see this is going to be something positive. Okay, I can say based on the I have been present for the past advisory council meetings for the child care licensing program. Things are in a complete mess, and we got to fix it. So I just want to say, hear me out first before you make comments about whether this is or this is not the right time. Okay?
I'm happy to hear you out, but as a member of the advisory council,
yes, ma'am.
The well-being of CCPP, I just want to say for the record, the financial crisis is the highest priority right now for everybody. And that's really what we need to be grappling with.
Agreed. But providers are struggling with meeting licensing requirements because there's a lot of confusion about what is and is not required. And it is a basic requirement to participate in CCPP that you must do. So again, listen, Sarah, I respect you. Okay, I appreciate everything that you're saying. Okay, just hear me out,
okay.
and then we'll talk about that. Okay.
Michelle Rittenhouse. I am on the Child Care Advisory Council. I am a director at Clinton Methodist Church Weekday Program, and I represent Rankin Child Care Directors Association.
Thanks for being here,
Good morning, Chad, and thank you for your invitation to serve on the Child Care Advisory Council for the Department of Human Services. I'm Dolores Sewell. I'm the president of the Child Care Directors Network in Mississippi, and I'm also the owner of Prep Company Tutorial Schools here in Jackson, and I have served on, and with this one would be both councils, which I kind of understand what you're saying, because we're writing these new plans, and some people are struggling to do that because we've had no training for it, and so we have a twofold problem. So I can see your point, I can see Carol's point, and I'm just glad that we can try to fix it. And it's really good to be able to bring both councils together to try and come up with one solution. And I've been in touch with legislators, and I think it's kind of being directed from them that we try and bring some understanding to regulation as well as the child care payment program. So I'm hoping this is an opportunity to come together and really get it right. We have to get it right, y'all, and we're going to have to work together in spite of our differences. Thank you.
Thank you, so.
Good morning. I'm Cindy McCarley. I run the Good Shepherd Community Center in Vicksburg, which also has a preschool in it, and I serve on the CCPP Council.
Good morning. My name is Rima Lynn Lewis. I am the owner of Cadence Christian Academy, and I am on the Child Care Advisory.
I'm Sally West, and I am with Hancock County Human Resource Agency in Hancock County, Mississippi, and I serve on the Child Care Payment Advisory Board.
Hope Jones, owner and director of Kitty Corner in Batesville, so secretary of the Child Care Council.
Lynn Black with Little Leap Academy and Little Leap Academy 2, Tupelo, Mississippi, and I serve on DHS Advisory Council.
Vincent Burke, in the Zone Child Care Services on the Gulf Coast. We have 3 locations. I'm the owner. I'm also the chair for the Child Care Advisory Board.
Debbie Ellis. I'm with Delta License Providers, and also I own the Learning Tree in Greenwood, Mississippi. I'm on the CCPP Advisory Council, and I think we are here today because a group of us, known as the Militant Child Care Providers, filed on the Child Care Advisory Council and the adoption of the most recent regulations. We filed a complaint to the Secretary of State. We've been referred to the Ethics Department, but we are not doing that at this time because an angel stepped forward to mediate, Chad, and ask if we'd be willing to get together to work these problems out. And that's all we want. We just want to resolve the issue. So for now, we are on hold, and we thank you for that because that was going to be a lot of work. Thank you.
I'm Nancy Sylvester, Director of Global Connection Learning Center. We're located in the Jackson Medical Mall in Jackson. Our emphasis is to service teenage moms, middle and high school girls who have babies. And I serve on the Child Care Payment Advisory Council.
Good morning, everyone. My name is Marnisha Cathy. I serve as the Director of West Point Christian Preschool in Hattiesburg, Mississippi, and I serve on the Child Care Advisory Council.
My name is Shelley Pugsley. I'm Director of Open Arms Christian Learning Center in Lowndes County, Mississippi. And I've had the pleasure to serve on both committees, both councils, and I serve on CHADS, the CCPP currently.
Good morning, everyone. My name is Jamila Taylor, and I'm with Mississippi State University Extension. And under our umbrella, we operate early Head Start and Head Start programs in Harrison County and Hancock, and also referral sites and oversee a Nurturing Homes initiative, which works with in-home child care providers across the state.
Okay, then. Tell the call.
Gina Puckett. I actually work with Mississippi Department of Human Services, but I'm on the Child Care Advisory Council for the NICA organization.
Okay. At this time, if we have any advisory council members from either the Child Care Payment Program Advisory Council or the Child Care Council with the Mississippi State Department of Health Child Care Licensing Program, would you please unmute yourself and introduce yourself for us, please?
Hi, I'm Regina Harvey. I'm the owner of Smart Beginnings Preschool in Ocean Springs. I serve on the advisory council and I am part of Forum for the Future.
Good morning. My name is Michelle Connolly. I'm the Executive Director of the United Way of West Central Mississippi in Vicksburg, Mississippi, and I serve as the Child Care Payment Program Advisory Council member as a support.
Hang on just one second. Just one second. Let me fix the speaker over here. Y'all, well, I know. So y'all, my computer died the other day and I had to have it re-imaged, which of course reset everything. Let's try that. Michelle, you want to go and try again?
Yeah. Good morning, everyone. I'm so sorry that I'm not with y'all. I will miss being with y'all today, but my name is Michelle Connolly. I'm the Executive Director of the United Way of West Central Mississippi in Vicksburg, Mississippi, and I serve on the Child Care Payment Program Advisory Council on behalf of the Mississippi Department of Human Services.
Okay. Who else?
This is Lori Gloyd Rollison. I own Little People's Christian Academy in Harrison County, and I am on the Payment Plan Council, but served on the Child Care Advisory Council for many years.
Thank you, Lori.
Hey, everyone. This is Matt Williams. Sorry I'm not there in person. I am Director of Research with the Mississippi Low Income Child Care Initiative, and I serve on the Licensure Advisory Council.
Thanks, Mike. Anyone else? Going once, going twice. Okay. So thank y'all for, again, thank you to the advisory council members for being here. And thank you to the members of the public for also joining us. So I will say, before we get into this, I do acknowledge that right now, childcare, we are definitely, it's a tight spot right now. Okay. We did in fact hit a funding cliff after the end of the American Rescue Plan funding when it came to a close. And despite everyone's efforts to try to emphasize how critical childcare is to not only our workforce of today, but also our workforce of tomorrow, it seems like some of our policymakers and other decision makers are a little slow to understand why it's so important that we invest. Now, again, I do understand that again there is a funding issue. That being said, we cannot overlook what has been and continues to be our primary source of funding, and that is why we're here today. Yes.
I wanted to ask about the target that you had set a while back of 27,000 kids. That was what DHS was aiming to get down to.
Mm-hmm.
And now we're so far below that. I just wanted to understand why that is the case and what the new situation might be looking forward.
Okay, so I'm going to speak to this really quickly, and then just that, because that is not why we're here today.
Yeah.
But I will say, so yes, we had to realign our budget with what we could currently serve. So we put a pause in place. We started having people on the waiting list. So November 18th, we stopped the pause on redetermination. We reinstated redetermination. So any families now that are coming up for redetermination, they should be going through that process. There was a question. So we had some families, and some of you have even contacted me directly saying, okay, the families received a termination notice. If that's happening, as I've told y'all and as I've said on information sessions before, if that's happening with our families, they need to contact our office because they are supposed to be allowed to go through redetermination. Okay. As we have had additional space, we have also pulled families off the waiting list. We've gotten the waiting list down from 21,000 families. As of last week, it was 9,000 something.
Oh, great.
Over the last week, we have notified 5,000 families to go in and apply. Some of them are going in and doing it. Some of them are not. So what y'all need to be doing is y'all need to tell those families, watch your email. Because when you get that notice, they have 10 days from the point of getting that notice to get in and get their application submitted. If they do not do that, we're keeping going because the need is so great. All right. At the point, if we get to the point where the waiting list has been, like we've notified every family on the waiting list, we will reopen the application up just like we've always done. Okay. And we'll say we have this many. You need everybody.
Hey, Chad, you're on mute on our end. I know you muted everyone, but we can't hear you online.
Okay, can you hear me now? Keeps muting me. Can you hear me now?
Yes.
Okay. Yeah, Crystal, we'll just ask everyone to mute, just make sure they mute themselves from here on out. So it's relatively easy to do face-to-face meetings. It's relatively easy to do all virtual meetings. But when you try to
Put you back over.
Okay.
Okay,
There you go.
Okay. Thank you. That's Shelly's kind of our resident technology expert. So what we're going to try to accomplish today, by the way, you have a copy of the slides in front of you. Okay. I know this room. We call this the trailer park room because it's just one big long, it's like a trailer, that I grew up in. So anyway, so you do have a copy of the slides in front of you. Okay. So what we're here today, first of all, I am going to take a few minutes to explain why in the world is Chad Allgood standing up here. He doesn't even work for Department of Health. So why is he even talking about the child care regulations? So what is DECCD's role in supporting what child care licensing does? We're going to review the current, is it still muting?
No, but they can't see your slides online. Just keep going.
Go to share,
Stay right there, Shelly.
Sorry, everybody.
Yeah, you can do that, or you can do share window, and then just hit that. Yep.
Last time, I promise.
No, don't apologize.
Stay close to them.
Okay, I'll do my best. I do like to walk, so I'll try not to walk too far. All right, so review the current regulatory structure, what the current regulations say, what are the challenges within the existing regulations, why are we considering making updates. We're also going to highlight some key areas of what we're proposing to do, and then share next steps and opportunities for input. Okay?
Perfect.
All right, so let's talk about what this process is and what this process is not. Okay, so first of all, what this process is, it is a review of the current regulations. It is an opportunity for childcare providers and other stakeholders to give input on not only what the regulatory language should look like, but the actual process for how this would go. This is a focus on identifying areas to clarify the regulations and improve the regulations so that childcare providers can more easily understand what is required of them. And also with our licensing officials, when they go out, to make sure that they understand what they should and should not be addressing. Okay. This is a collaborative effort, and this is a collaborative effort to help support and strengthen our childcare system as a whole. Okay. What this process is not, this is not an immediate rule change. Okay. This process is going to take some time. The regulations have been decades in the making. All right. And you can't restructure or redo that overnight. Nor do we need to redo that overnight. We need to give you all the opportunity to give us feedback on what's good, what's not good, what needs to be changed. And also, we're going to do this in a phased process, okay? We're not going to throw a bunch of stuff at providers quickly, okay? That's not what this is going to be. This is not a process that is intended to increase penalties or enforcement. I've made some pretty crazy suggestions to our friends at Department of Health. They seem to agree that what I'm suggesting would work. Okay. And I'm going to kind of talk a little bit about what I'm proposing. But again, as the last point says up there, this is not a decision that has been finalized. Okay. None of this has been done. All right. This is just for us to say, this is what we're considering, and let you all give us feedback on, do you think this is something that we should do? I'm going to explain why there are some things that we have to do, but I definitely want y'all to give me input on this process. Okay.
Of the things that we have to do, is there a required timeline?
No, so I'm going to get to all the whole process. Okay. Yeah. Also, this is not a process that is designed to create more unnecessary steps or paperwork. Okay. All right, so I'm going to talk for a minute about why DECCD is even at the table with this conversation. Okay, why are we even in this? So, as I mentioned, we do acknowledge that there is a funding crisis for childcare. Okay, and we definitely need to be putting attention into that. But at the same time, we cannot neglect what is and has always been the primary source of support that we currently have. Because if we lose that, we lose everything. And that primary support that I'm talking about is the Child Care Development Fund. That is the federal stream of money that comes to the state of Mississippi. We use that money for all the child care certificates. We also use that for all of the training, coaching, all of the support activities that give you all the free training and the free resources. Okay. So CCDF, this is something that some people don't understand, and some of you may or may not be aware of this, but I felt like it was important to clarify because I was interested to find out that some of our legislators were not aware of this. The Child Care Licensing Program is primarily funded with CCDF money. Okay? It is not state money. The Department of Health, they take in a little bit of money from licensing fees. But other than that, they depend on the funding that my agency gives them to run that program. In the state child care licensing law, it establishes Department of Health as the agency that promulgates the rules and oversees licensing. What it does not do is satisfy the funding requirements for that program. What Mississippi law does is it does require that MDHS transfer $1 million every year to Department of Health to run the licensing program. Now, y'all know good and well that doesn't cover it. So what we have to do on top of that is we have to establish a contract between the Department of Human Services and Department of Health for the additional funding that they need to run that program. Okay? And the reason that that is so essential is because for us to continue to draw down our CCDF money that is so critical to support childcare, the federal government requires that each state establish monitoring processes on health and safety standards. Mm-hmm. And in our state plan, we have to lay out how we will properly monitor childcare providers on 12 health and safety areas. Okay? So childcare licensure, yes, they do have authority, Department of Health, by the authority of Mississippi Child Care state law, they do have the authority to license facilities. Department of Human Services, however, is the lead agency for the CCDF program. And by federal law, it is MDHS's responsibility to make sure that the monitoring of child care providers based on federal requirements is conducted. Because guess what? If the feds are not happy with our monitoring processes, they don't go to Department of Health. They pick up the phone and they call me. As a matter of fact, I was on a federal call just yesterday, and we had to talk about areas that our current regulations are still in deficiency with some federal requirements. That's why this is a critical project. Okay? The feds have given us grace because we have accepted technical assistance and they know that we're trying to fix some things. But every time I get on a call, they ask me, well, Chad, what about this issue? What about this issue? Okay. It's very important that we stay in full compliance with federal law. Why? Because we cannot risk losing CCDF money. And one of the things that the feds can and will do is if we continue to remain out of compliance, they will start fining us. And guess where that money comes from? CCDF. They would make us pay it back. All right? Something that we definitely do not need to do. So again, while we have a partnership with Department of Health that I'm very grateful for, because they do handle the monitoring piece that's in our state plan, there are just simply some things that have to be addressed and fixed. And the infrastructure of the current regulations, in my opinion, is causing that to be a hindrance. Okay? I've had conversations with the folks at Department of Health. I've had conversations with the child care community. Before we even had this meeting, I asked for input. I said, do y'all think that this is something that we should address? Because there are other issues. But because of the critical nature of staying in compliance with what the feds require, I think this is something that we need to consider. Okay? And all I'm asking is that y'all hear me out. Let me tell you what I think this could look like. Give y'all an opportunity to give us feedback. Then and only then, I ask that y'all make a judgment call on whether or not we need to proceed. Okay? That's all I ask.
Yeah.
Okay. So I really already kind of talked about this. So it is a partnership between what the federal government requires and what the state government and what state government requires. So federal law, the CCDF, which is authorized by what's called the Child Care Development Block Grant. We love our acronyms, don't we? We call that CCDBG for short. So the Development Block Grant, that is the law that Congress passed to authorize funding to go to child care. Okay. So that's what authorizes the Child Care Development Fund. So as I mentioned, it provides funding for child care, which includes our subsidies with what primarily it's the primary use of the funding, but then also quality improvement and monitoring with health and safety requirements. It also requires that there be background checks. I know y'all love that process, but it's what the feds have set aside. That being said, maybe there's room for us to make that process a little simpler. Okay. Training and monitoring. And then the federal government establishes expectations for what they want the state to do in terms of providing oversight of our child care programs. So Mississippi law, which is established by the Child Care Licensing Law, by the way, if y'all want to go check it out, it is Mississippi Code 43-20-1. Okay, if y'all want to go look it up, that is what's known as the Child Care Licensing Law of Mississippi. You can go read it for yourself. 43-20-1. So what does it do? It requires that child care providers be licensed if you're classified as a child care program and you do not meet one of the exemption criteria. It establishes state-specific regulations and standards. It defines health, safety, and operational requirements, and it establishes the Mississippi State Department of Health as the agency that oversees inspections and compliance. Okay? Any questions about the relationship between federal and state law and requirements? So bottom line is, Department of Health, they're responsible for the monitoring based on state law. Okay. Federal law makes me write the check. Okay. But along with being able to write the check, there are things that has to be done.
When you say things have to be done, are you still making the move for DHS to take over childcare completely?
So I think that we can have that conversation. That is something that I only feel should be done if the child care community thinks it would be beneficial.
Well, we didn't have the conversation when it happened last.
So the thing, so the thing is the law. So when Senator Boyd, passed, I really didn't know that the law was going to be introduced that quickly. I did not author that bill. There were some conversations about the two agencies. I will say, as soon as the law dropped, I met with my advisory council, and I told my advisory council, we discussed the law, what it could potentially mean. Okay. I'm responsible for the goings on at DHS in that regard. Okay. So I hear you. I think that there could have been an opportunity. I do know that there were a group of providers that met with the Mississippi Early Learning Alliance. There was a discussion, but at no point did those providers or did representation from the Mississippi Early Learning Alliance say, hold up, why don't we go talk to Chad about this law, about language that maybe needs to be updated. So Vincent, I think that this would be better for y'all. Yes, I'm a little biased in that nature. I would like if y'all feel that this may be something that we need to introduce, let's open up the language and let's look at the language in that bill. Let's talk about what y'all are comfortable with, what you're not comfortable with, and let's make those changes. Because it also does provide an opportunity for child care providers to get real representation in how they are regulated and how the state provides for the oversight of their operations. I do think it provides an opportunity, but just like with this process, that needs to be a collaborative effort. And I do think it happened a lot quicker. To be completely frank, I was kind of blindsided because I was not aware that the bill was dropping that quickly. There had been some discussions, but it had just been, what if we, looked at this? But when it dropped, I was kind of like, oh, well, here we go.
I have a question. Just piggybacking on that, when you say come to the table and have some conversation around the law. You mean provide some of our feedback so this bill can be reintroduced in the next legislative session? Is that what you're saying?
Possibly, yes. I think that as a group, you all, child care providers, y'all need to decide how y'all want to be represented. Y'all need to decide what you feel is best with how you are regulated and how oversight of child care is provided. Then y'all as a full group need to go to your legislators and say, this is what we want to see happen. Y'all, I'm here to serve you all, okay? Would it make my life easier if the two programs were under one agency? Absolutely. Because it would, what you say though, is less work. It's less work. It would be less work. I think that Department of Human Services could provide stronger oversight of that program. And I'm not discrediting Department of Health in any form, shape, or fashion. They are very, they're very good partners with us. Yeah, do I think it would be beneficial for me? Absolutely. But the real question is it beneficial for y'all and for families? Ms. Sewell?
Well, I'm going to let everybody know I was one of the people that went to Senator Pope. And my reason was that whereas the Department of Health has a board of directors, the Department of Human Services does not. And we felt, there were 4 of us that we needed oversight to represent and be able to go to someone if we disagreed with policies. And at this point, the way we saw the way the policies are, we would have to go directly to court if we had a concern. I've gone through the process, I've gone to the court, so I know what happens. And I felt it would leave a void for us to have nowhere to go if we totally disagree with some of the policies. So that is the position of the group. And we ask that until that is done, that nothing moves, because we do need to be protected.
And I think you need proper representation. And I think when I say that we can open up the language in the bill to look at what the structure is, I think, but again, childcare, y'all as a whole in the state of Mississippi, y'all need to find ways to come together as a whole to make sure that all childcare providers' voices are heard. There's adequate representation, and y'all have to take that to your legislators directly.
But they got to come down, Chad. We can't get them to come down. If they come to the legislature and meet with us and come when we're at the Capitol, when we're talking, we're trying to get groups together, we can't get it. So those people that are there are the ones that end up representing you. If you want representation, we don't ask anybody not to be a part. And the Child Care Directors Network, we try and make sure that we represent all child care providers. And we do send out information for people to know what's going on. If you don't reach your email, then it's nothing that we can say. And Debbie is our person that sends most of the stuff out. And I know you get a bunch of stuff from Debbie.
Oh no, I've been trying to save for the most aggravating ones.
So
to send out.
So again, yeah, and I don't want to get too far off track, but I will say, I do think that, this is an opportunity for y'all to look at, again, how childcare should be monitored. I feel like, and which it brings us to my next topic, the importance of childcare. So the industry itself, let's just be completely honest, there are folks that don't give this industry the proper respect that it deserves. Okay. And I think it's because people don't really understand what childcare really is. So I was at a Senate hearing, and I had a senator come forward and say childcare is not education. I spoke up immediately and I said, you're wrong, and here's why. But again, there has to be a level of representation to help change that mindset. Okay. And that's something that we all have to come together to do.
say something?
Sure.
So everybody, my name is Glenn Wood, and I am the Division Director for the Office of Licensure and Certification. So not only is childcare under our watch, but also we cover healthcare facilities and a lot of other professional licensures and everything. And so I just want to let y'all know that from my perspective, Tara and I are new into our roles as far as making sure that your programs have what you need from the licensure and regulation side. And so I just wanted to let you know that we do value our child care providers and that we are here for you. And I can't speak for our predecessors that were before us, but just know that you have our commitment and our dedication to try to help serve you guys and make sure those communication lines stay open. And before you leave today, I'll make sure that you have our contact information. So if you have any concerns, you can contact us. But please know that we're very supportive of this meeting and we're very supportive of the child care community because that all falls under health protection, which is what we do. And we're coming at it from the regulatory side and all that, and we want to make sure that any regulation changes or anything like that come forward that you're aware of before they go into effect, and then that way we can get your input and make sure that it's not going to have any undue burden or any anything like that that's going on. So I just wanted to say I appreciate the opportunity for us to be here today, and we want to work with you. And we're very excited to work with Chad on moving forward and opening those lines of communication and being a support for you guys, because we don't want you to look at us as the bad guys coming in. We want you to look at us as a resource to be able to help you if there's a regulation you don't understand or if there's something along those lines. Please reach out to us because we would love to be able to share anything. Yes, ma'am.
I just had a comment because when Chad mentioned earlier about the Senator Boyd's law dropping, he said he immediately had a meeting with his council. And being a member of the Health Department Child Care Advisory Council, there was nothing. Right.
And please know that that's one of those things that we're committed to do is to, when we find out about those type things, we want to make sure that those lines of communication are open to you, as providers. And so, but I'll be glad to speak with you. I know we've, in the essence of time, we want to make sure that we kind of move forward, but we'll be available on a break or even after the meeting today and be able to help try to answer any of your questions or anything like that. So, but I just wanted to introduce myself to y'all so you could, you may have seen my name on some things come through, but I wanted to let y'all know who I am and just know that, we're in support of you guys and, whatever we need to do to help. And, I appreciate the opportunity to be here. Thank you, Chad.
May I say something?
Yes, ma'am.
Thank you for that, Glenn. I would like to say that we tried to reach out. We offered help. We have expertise.
Yes, ma'am.
We got nothing but disrespect, rudeness, and dismissal. And so that's the reason, if this process does not work as we hope it will, we will move forward with an ethics plan.
Oh, yes, ma'am.
And that's a legal process, and once it's done, we cannot discuss it.
Yes, ma'am. Well, we're very encouraged about the joint meeting today
Yes.
and moving forward. And, but I would be glad to talk with you, once we get on a break or afterwards. I would love to be able to, chat with you.
Well, if your staff members are not interested in listening to us, the Secretary of State has provided and published the Administrative Procedures Act.
Yes, ma'am.
That act is not for them, it's for us. It's to protect us. That's why they have to follow it, to protect us. This is government by the people.
Yes, ma'am.
And so I would suggest starting there with all the staff members from child care.
Right.
One regulation at a time under Administrative Procedures Law, so they will understand what we're talking about when we say, no, this is not how you do this.
Yes, ma'am. And I'm very familiar with that because, I update regulations for health facilities, for hospitals, home health, hospice, surgery centers, anything on the medical side. I'm deeply involved in that. So I'm very familiar with the Administrative Procedures Act. So I really appreciate your comments on that. And
may I also say that the Child Care Advisory Council works for us and the Department of Health Licensing Bureau. They're trying to control them. They're giving them time limits, rolling their eyeballs on Zoom. It's just been horrible. So I hope, now Chad doesn't roll his eyeballs at me, but he's had some good learning. But I want to let you know that there are people in this group that we're not going to tolerate that, and they should know that. So,
Please know that it's my desire to have a good working relationship with our council and with the child care facilities, because when it all comes down to it, we're all on the same side and wanting to make sure that our children have safe care and safe facilities. And that's the whole goal, is to make sure that everybody is safe. And that falls under our role, under our division of health protection, not only for our people in the medical facilities, but also in our child care facilities as well.
well, we want them safe too. Liability
Yes, ma'am.
insurance is outrageous. So we want them safe too. And may I say one other thing too about the writing of the bill to consolidate licensing with DHS as the lead agency, which is how it's done in almost every other state in the nation. But I'd like to say, I have an issue when they turn to nonprofit organizations that have never made a child care payroll in their lives to come up with the verbiage, and they don't even contact us. Now, I am an associate, a participant, a member of MELA. Not one time did I receive an email of any kind saying, hey, what do you think about consolidating these agencies? You'd be surprised at how much support we could give if they would ask. We have the expertise. Until Mississippi, and I'm saying this to every member here too, until nonprofits understand that we are operating private businesses, we're never going to get anywhere. But we have just been bullied enough. And don't tell me we're not meeting quality. We are. And don't tell me we're just about money. You dadgum right. But we don't get a grant. So I just want to say right now that we've had enough of that, and we're hoping that you can mediate as you have offered to do, so that we don't have to go through a legal process of a complaint, et cetera, and we can address the things in here that need to be addressed.
Chad, I want to ask him one question. I'd like to know the line of communication, say if we had a concern, exactly, you're here, the next person there, we have no idea. I had no idea you existed.
Right, well, I'm fairly new into this role.
And so, and my license and all, so I don't know anybody else in the office.
So Tara German, if y'all have not met Tara yet, Tara, raise your hand. So Tara is the child care director over the child care licensure program now. And so, as you know, for several months, that are maybe more than a couple, maybe 2 or 3 years, that role was vacant. It was filled by other administrators, but we have a full-time person now that has taken the reins of that, and she'll be your primary communication person, you know, if you have any questions. And so we'll make sure that you get our contact information before you leave today.
Can you also make sure y'all share that with the council? Because I serve on the council, and this is my first time.
Right, like I said, we're still relatively new to our role, so we're working.
But that would have been nice to know, even when you approach the role, that we got that information.
Discuss the language needed to consolidate the two agencies.
I agree. Yes, I agree with that.
And that was one of the things that I was going to say. I really think that there need to be transparency. And that way, one person doesn't think one thing or see one thing or have just be transparent. If you all are changing, we need to know who's in what role, so no one can speculate or assume.
Yes,
but transparency with the Department of Health, transparency, and I'm not saying this just to say this, but Chad has done a wonderful job as being transparent of his division of who we need to go to. We can't get him, we know we could go to Angela. We can't get Angela, we know we go to Cynthia, and that way. But if we can just have that transparency, I think everything will work fine.
That's one of the goals that we have, because we do recognize that has been an issue in the past. And, you know, and I will apologize if you felt like that you've not had the transparency that you needed, but just know that, you know, Chad and I have met on several occasions, and we have a common vision, And just know that, we're going to do everything we can on our side to have that transparency. If you ever have any questions at all, please feel free to reach out to us, because sometimes we may not know that there's an issue in the community, but we want to make sure that if there is, that you let us know so we can address that for you. And so I appreciate your comments, and I appreciate everybody's comments today, and thank you all for giving me just a moment to speak. Thank you, Chad.
Excellent.
I have just one more thing to say, and then I'm gonna leave it alone. I do agree with what you're saying with transparency, but sometimes if you don't know what to ask, then you don't know to ask. But wait, let me finish. And the reason why I'm saying that is because I didn't know to ask that there was new leadership, because that had never been shared, that leadership was being changed or even being considered to be changed. So that's what I mean about sometimes you don't know what to ask, because of the simple fact it hadn't been brought to light that there's maybe some changes in our leadership structure. So if you could even begin to provide some communication with your advisory council around, who's in those leadership positions, who do we contact as advisory members, so that level of transparency is there first, then we can then share that with the rest of the child care community as well.
Yes, ma'am. And that's one of the things that Tara and I have discussed, and we've got several options that we're looking at to have several different methods of communication, rather than just maybe a face-to-face meeting, maybe a combination of that, plus some other things that we can do simultaneously that's going to be able to get the message out. And then at least to advisory council members who can then disseminate that information out to the providers themselves. And so I appreciate your comments, and thank you very much. And just know that all questions. So thank you.
Thank you.
Okay, so I want to talk about this because I want to try to leave us before we go to a break on a positive. I don't want anybody meeting in the back alley for a brawl. That was a joke, y'all.
Yeah. If Dawn stays down, they tell you whether or not it's a joke.
I know y'all will throw down. That's why. Okay. So I think what we've demonstrated here is that childcare represents a community of people that value what they do, and childcare is critically important. I like to say I grew up in childcare. Pretty much my entire career has been in this field. Okay. When I was in college, I was at Meridian Community College. I was trying to figure out what in the world I needed a part-time job because my parents weren't paying my gas. They helped me make sure my tuition was taken care of, but my spending money, my pocket money, if you will, that had to come from me. And when I was looking for a job, Miss Nelda Skinner, who was the director of Wonderful World for Children on 23rd Avenue in Meridian, Mississippi, she had just fired her 3-year-old teacher for using the F word with a parent. Yeah. So she offered me a job, and when I called my mom and told her I was going to be working with 3-year-olds, she started laughing. So I'd never done that before. But I fell in love with the work. I fell in love with early childhood education. I fell in love with childcare. And, we have a saying, childcare is like the mob. When you're in, you're in. It seems like every time there's been a fork in the road in my life and I've tried to get out, something keeps pulling me back in. Childcare is critical, and it is certainly a workforce issue. Okay. Working families have to have childcare to go to work. Okay. And I think that's something that everyone can agree on. But the problem is that's not all that childcare is. Childcare is also about not only the care, but the education of our children. And y'all all know how important those first few years of life are. Nurturing these children is critical to set them up for success as they continue learning and then eventually enter the workforce. Our policymakers just don't seem to be getting it. And now there seems to be a division between what the federal stance is versus the state stance. There's a video that's circulating around. Y'all can look at it if you want to. where comments were made that childcare is not the responsibility of the federal government. It's the responsibility of states. And y'all, that scares me because the federal government has been funding our childcare industry for as long as it's been around. And if the federal government suddenly decides that that's not their responsibility and they cut CCDF, where are we going to be? So again, the thing is, y'all, we have to, when we're addressing the funding issue and everything, we have to look at multiple avenues. Okay, we can't put all our eggs in one proverbial basket because we don't really know who's going to be holding that basket in the coming months. So it's very important that everyone understands how critical childcare is. Okay. And I just wanted to take a second before we're going to take a break after this. But before we get in, I just wanted us all to take a moment to remember why we're here, why we're sitting at these tables, why I'm standing here talking to you. It's because I value what you all do. I know you all value what you all do. So again, as we're moving into looking at this process, what this can be, I want us all to try to look at this as a way to strengthen childcare, to make it better, but also to address some systemic issues that, because we're dealing with things, because people are unclear about what the requirements are, the ethics, the ethics complaint, things like that. Y'all don't need to be spending your time focused on whether or not the regulations or the enforcement of the regulations the process for that is going through the proper legal steps. Y'all need to be focused on helping people understand how important what you do is. We should not be fighting amongst ourselves, and we should not be fighting with legislators about how we're regulated. We should be going to the battle lines with talking about how do we invest in our children? How do we invest in our programs? That's critical, y'all. Today, what we need to do is we need to take a hard look at the regulation and the oversight of childcare. How can we make this overall process simpler, more streamlined, easier to understand, easier to follow for everybody? Okay? And I'm not saying, like I said, this is not going to be a fast process. This is not going to be something we're going to snap our fingers and there we're going to be. But if y'all will just dig in with me after the break when we come back, listen to what I'm suggesting. Give me feedback on what you think is going to be good, what you think maybe needs to be fixed. Let's have a real open conversation. Y'all just keep an open mind about this. I do acknowledge that there are a lot of strong feelings, and I completely understand and respect those. Okay. But today, let's try to focus on, okay, how can we fix this? How can we make this better? Okay. All right. So with that being said, I'm going to give you all a 10-minute break. Like I said, there is coffee and water. Restrooms are around. You can also step outside if you need some fresh air. There's vending machines. Okay, come back in 10 minutes.
A lot of my snacks, if you want to eat some just
Hi, everybody. We're going to get started again. Okay. Oh, we're missing some.
Get started. Help us out. And turn your mic on. Lisa said, turn your mic on. Lisa Daniels.
I thought I did.
Wait a minute. Let me make sure.
Can y'all hear me on virtually?
It's on.
Yeah, I don't.
Maybe I can scroll up. And I know no. It's a tough call.
We walked out of this person we're like, oh, we were
Okay, so as we're getting into this next part, I just kind of want to talk about a little bit of what we see as some of the challenges with the current regulations. No, we're not going to do a deep dive again because we just don't have the time today. But again, y'all, this is about just trying to explain why we feel like this process is needed. Okay. Yes, ma'am.
You said, are you looking at a timeline to try and do it? Have you set a goal?
Not yet. That's one of the things that I want to talk about today. I mean, I think this process will probably take several months, if not.
I think that, but I think it'd be good if we could try and. I know.
Yes, ma'am.
But I just want to close to the judge. It would help us, you know, and I guess work hard, knowing what the timeline is.
So I want to show y'all what I think might be a good way to break it down into different pieces and have it set up in phases where we can focus on each thing, because the regulations right now are 270 something pages long, and we need to cut it down. It needs to be more digestible. But I think I want to show y'all what I think might be a good way for us to approach the writing. I think we would probably have working groups, or we'd break y'all up into we would have people that would sign up for different working groups to focus on the language, to focus on the review. And then at each phase, we would bring both councils together to review, discuss, and then vote and make a decision about moving to the next phase before we finish that phase. Does that make sense? I'm gonna get to that. Yes, ma'am.
Trying to take it, but I think if we understand the role, the function of each division, what actually does the health department, what are their responsibilities for child care, and what are the responsibilities for DHS, and I think that will help to understand what actually need to be there, and if there are state laws, fine, but not to inject things that are not law.
Right. So yes, and I think that's the whole. Like I said, when I get to the part about how I'm proposing we lay this out, I think we'll be able to have that discussion in more detail, because I agree with you. Y'all also remember there's 2 guidance documents that are used. So for the licensing portion, which every provider has to do, those are the regulations governing licensure of child care. Okay. So that is the set of regulations that's under the purview of Department of Health. Then you have the Child Care Payment Program Policy Manual, which governs the policies of the Child Care Payment Program. As this process moves forward, if there is anything in the we do not need to combine those two documents, because you have child care folks, you have child care programs that don't participate in CCPP, and I don't feel like we need to muddy those waters. But we do need to make sure that the regulations and the CCPP policy manual are in alignment with each other. So as we move forward, if there's something that we change in the regulations that may have an impact on the Child Care Payment Program policy manual, then we would do that. And just as a reminder, y'all, when we updated the CCPP policy manual, what did I do with y'all, my advisory council? I came up here with y'all for 2 solid days, and we went line by line through the entire policy manual. Okay. So what I'm saying is, this is going to be a similar process to that, Ms. Sewell. Like, we're going to get down in the weeds that much with the regulatory information. Okay. That's what I'm essentially proposing we do. Okay. All right. So just some of the challenges that are with the current regulations. And I will say, y'all, I've talked to Department of Health. They agree that these are also struggles for them also. Okay. So some regulations are outdated. Some of them don't really apply in given situations. Again, the regulations are 40 years almost that they have been in place. So, and as the years have gone by, there's been things that have been added. There's things that have been taken away. There's been entire appendices that have been added. And in some places, they're outdated. Some requirements are not clear. There's room for interpretation. Interpretation in regulatory language is a bad word. There should be no room for interpretation with any regulation that is established, because you don't need gray area. It needs to be very clear what the requirement is. There should not be, well, if you're doing it if you have this kind of center, you do it this way. No, there should be none of that in regulatory language. It needs to be very black and white, no gray area. There's heavy paperwork and documentation requirements in some areas. There's also limited access to training opportunities, particularly around the way that y'all are just required to get carte blanche 15 contact hours. Okay. I think that we could address the training requirements for teachers to work for everybody. To not make it just a box that we're checking off. Training needs to be intentional. It needs to help your teachers understand their role better. So can we find a better way to frame training requirements to work for you all and your teachers? Okay. And then y'all know it's difficult to recruit and retain qualified staff, but we also have to be realistic about what the expectations are for staff based on what we can pay them.
That part.
So any questions? Just any comments on? Y'all disagree with any of this?
I would just like to add that some of the regulations are unconstitutional and unlawful. So
and
that needs to be addressed.
And I think, just again, as part of this process, that's why we're not proposing that we amend the current regulations. We're saying, let's create a new set of regulations.
And that's not unusual. Agencies across the country often extend an overreach, and there is an agency to address that, but we need to be able to address it here,
right,
and resolve it and move on.
Right. I agree.
Yes,
ma'am.
In light of the fact that the ultimate decision making at the moment implies the board of the health department, is there any communication there for some assurance that if all this work is done, that the board of the health department's going to give a green light instead of a red light? I know years ago when I was on the advisory council for licensure, and we had a set of regs written with the help of an outside consultant, the board didn't adopt it, and that was months of work that went down the drain as a result of that.
So I'm going to say this. lines, if you will. Okay. I mentioned earlier state law. So state law requires Department of Human Services to give $1 million for the licensing of child care programs. Okay. Federal law governs that DHS oversees the monitoring of child care providers. Okay. It is in the best interest of both agencies to move forward with this. Period. Okay. I'm required by law to give $1 million for the licensing of care providers. The monitoring process, I have liberties if I say DHS can take other approaches if we have to. I don't think that's going to be the case. I hope that will not be the case. But I feel like if both agencies or representation from the bureau within the agency, if they're on board with that, the lead agency that funds the program is on board with that, both advisory councils are on board with that, the provider community as a whole. If we're all speaking to that and the Board of Health doesn't recognize that, then we'll take appropriate action at that point.
And maybe they can understand it from we're not in compliance on all those 12 health and safety areas, which are from the feds. So if that's an understanding of language that the board needs to be able to understand, to be able to comply so that we can move forward, then that may be some language that needs to be stated very clearly to the board.
Sure.
Because nobody will be here.
Correct. That's right.
And one more thing, HHS recommends a review and consideration of amendments to child care regulations once every 3 to 5 years, not every 6 months.
Right.
Not every year, not every December, but every 3 to 5 years.
And what's the changes though, when you have these type of changes, there has to be a cost analysis done per facility, because there's people that they've already lost 30 to 60% of their kids, if not more, that we represent. That they can't afford another dollar. They're lucky they're staying open right now. So, I mean, I know that everyone's suffering right now, but I think this could be a wonderful thing, but understand the cost of what it would cost if you change your education component to say this is what's required of each teacher, and not consider the cost of that and what it's going to cost the teacher, what it's going to cost the owner to pay the staff that you're requiring that training for. So that's something I think everyone at this table that owns a facility and directs a facility understands it. How hard it is for us to keep qualified people at the qualifications they're at right now.
It's not feasible to ask a teacher working in an early childhood classroom based on the pay to expect them to have degrees and everything. I mean, I'm not knocking college degrees. I mean, Lord knows I have a couple. But it's not a degree in and of itself. The certification in and of itself is not the best predictor of whether or not a teacher is qualified to teach. And if you don't believe me about that, just walk into a public school classroom.
Exactly. Said that, what he said just now. He said that as a businessman.
Yes.
Right. And I want to let you know that's already the law. It's an administrative procedures law, and it's called an economic impact statement. And we have filed a lawsuit based on that. I tell you what, other than the American with Disabilities Act, APL law is one of the strongest pieces of legislation Congress has ever written. And so people need to go to Secretary of State's website and read administrative procedures law. It might be 8 pages, heaven forbid, but you can read 1 page at a time, but that's called an economic impact statement. It is required.
And I think, and again, with what I think when we get into what we're looking at, it's, Debbie, you said earlier, you all have the expertise. Exactly. So as we're looking at building out what is not only reasonable and rational, but what is considered best based on y'all's perspective at having qualified teachers in the classroom. And when I talk about the representation for childcare, that's what I'm saying. People that don't work in childcare should not be deciding what operationally it looks like every day. No one's opinion should matter more than the people that are actually doing the work. That's why in other industries, board of medical examiners or the cosmetology board, it is comprised of who? It's comprised of people that actually do the work. So, that's what I'm talking about. All right, so which kind of leads us into this thing. Why are the regulations updates being considered? So first of all, a regulatory update could help improve the safety for children and program quality. Why? Because we need to simplify it to make it easy to understand what is needed around health and safety. I use this analogy. We miss the forest for the trees. Okay. We need to really be focusing in, and Department of Health, this is not I'm not pointing a finger or a slight or anything. 3 years ago, I think it was, there was a situation where there was a child care person. There was a video where weapons were being brandished in the parking lot of that child care facility. I was personally sued because I said I'm not allowing this person to participate in the child care payment program. Because of some of the regulatory language, Department of Health was not able to shut that provider down. But yet, and that person is open and operating. So, and that's just one example. Okay. I had another example. I have a video sitting on my computer right now that shows teachers drinking in the kitchen of a child care center. Yeah. So we're missing the forest for the trees. Okay. The regulatory language needs to be changed so we can address stuff like that. And remove some of the things that, and the licensing officials, they can't do their job properly because they're like, okay, they're trying to, in certain cases, like when they're trying to bring up the revocation of a license, the regulatory language doesn't give them what they need.
Right. That should be a class 1. And
easily,
and
yes.
Weapons should certainly be
yes.
a class 1.
Well,
immediately.
Well, weapons. It says they're prohibited,
but
it does. Correct. There needs to be changes where even the licensing officials, they can do their job properly when they see stuff like that. The regulatory language should work for everyone, including them, because some of the licensing officials, like when we have discussions all the time, they have a situation, but they're like, okay, what regulation can I use to back this up? When it's clearly the child care program is not doing what they're supposed to be doing in a certain area. So that's important. Align regulations with current research and best practice, but best practice from the perspective of the people that do the work. Okay.
So I'm glad that you said that, because I think some of the stuff, and we've had this conversation, that things happen. And when things happen, if you never ran a facility, you can't say, well, I'm still going to write you up, because we all have experienced since COVID where these people have gotten sick from these children. And then, well, we're going to call because you had to shut the center down. Well, that was an emergency, because I've had 8 teachers that had to go home because they were sick with the virus that they've gotten from a child that a parent brought. And I'm glad that you said that, because we know from day to day that things happen. And when those things happen, that is beyond our control.
So I think what you're talking about, Lynn, when we talk about like emergency, like, because that is even though we don't typically think of teachers being out, but the thing is, because I've been a director too, and I've had like 4 or 5 teachers all calling, they get that Monday virus. You have 4 or 5 teachers that are out, you can't cover your classrooms. That is an emergency situation. We need something that gives guidance on how you can, handle that situation where you're not being cited for something that's really beyond your control. But that being said, there needs to be guidance that you can follow.
Right.
Okay.
Yes.
Reduce unnecessary administrative burdens. I think y'all are going to like some of what I'm suggesting, particularly around investigations and monetary penalties. Provide clearer guidance for you all to know exactly what it is that needs to be done. But not only that, where there's no gray area where your teachers are not knowing. A lot of violations that happen is because teachers do not fully understand what they need to be doing either. Supporting the early childhood workforce, supporting the teachers, that are going to classrooms. We talk about orientation plans, but I don't know that. I think we could do a better job with the regulatory language about establishing what a proper orientation should look like. And in a way, because the thing is, typically, when y'all have a new teacher that starts, y'all need that person in the classroom immediately. So what are some ways that we can properly support that teacher? And that goes beyond just what the Department of Health will do. That's something that DHS, because we have our coaches and we have our folks, how can we better support new teachers that are going in the classroom? So I think this would be an opportunity there also. And then improve consistency in monitoring and enforcement. Again, in regulatory language, there should be no gray area. There should be no room for interpretation. Two licensing officials and a child care provider and Angela Crockett should all be able to read a line from the regulatory in the regulations and all be able to know exactly what it means. All four people should be able to read that same regulation and know this is what that means. There shouldn't be four different interpretations of that sentence or of that regulation. Okay.
We use Bright Wheel, which is a reputable, and everybody know about it. But because they're not approved, we can't use their training, which is some excellent training. And I don't think that's one thing that really needs to be concerning, and because we may know about a training that's really good or have decided to go somewhere to a training, and then it's not there, then we just lost some time and money.
And I think having approved organizations that are approved, et cetera. Again, I think that's something that I think that's something we certainly need to address. My recommendation around that is the advisory council should meet during their meetings. They should vet and approve training organizations. That's my opinion.
No training, then, and we can show that they are training nationally or whatever. I just think we should be able to submit something to show that they do this.
Correct. And and on the other side of that, we've had certain situations, there's people that say that they're qualified to teach first aid and CPR, and then we've had providers that pay them, and then lo and behold, they're not actually certified. So I do think there are some gaps in how we approve professional development training, and I think that's something that does need to be addressed as well. Okay, so as we are moving into this project, or potentially moving into this project, it is important to set guiding principles, because this is the framework for why we do what we do. So we have to remember, whatever we're doing, children's safety is most important. I think, as we move forward with this project, when we're looking at language that we're putting in the regulations, the first question that we should ask and be able to answer emphatically yes, is this going to help keep children safe?
Right.
Is this in the best interest of our children? We need to be able to answer yes before we move forward with putting in the regulations. Clarity and consistency is very important. Again, no gray area, no room for interpretation. Rules have to be understandable by everyone that's reading them. The licensing official, the child care director, the teacher, the coach that's providing help, anybody that is reading it needs to be able to understand it. Regulate the regulations. The other thing is, and I don't really love the word regulations because there's immediately a negative connotation that goes there. But the licensing regulations, the licensing requirements, it should be a guidebook. It should not be seen as something negative. It needs to be something positive. Y'all need to be able to look at it as a go-to, like a how-to guide. And the way that the regulations are structured, they need to be written in a way that they can be referenced. Like when y'all have a question about something that's going on, you should be able to go to the regulations, reference that situation, and say, okay, this is what we need to do. Okay. So when we talk about providing support, are the regulations, are they practical? Are they achievable? Are they doable? Do they make sense? They do need to be evidence-based on what is best for the development and well-being of children. We need to reduce burdens. We need to streamline processes wherever we can, make it easier. And again, I've got some suggestions I think y'all are going to like. Transparency and stakeholder input is also important. I also think in the regulations, in the rewrite, we need to establish exactly when and how the regulations are future updates or changes will be made, how they will be vetted, how they will be approved. Okay. Any questions about those guiding principles? Okay. So then what are our ultimate goals? And I promise we're getting down to it, but I want to make sure that I'm setting the stage properly. So first and foremost, y'all, we need to make sure that we're meeting the federal requirements. Okay. We don't meet the federal requirements, I've explained. That's where the funding comes from. Okay. So in the process that I'm going to suggest, the first step is going to be making sure that we're meeting the federal requirements. Okay. Secondly, we need to update staff qualifications and professional development expectations that make it easier for y'all to get teachers and keep teachers in the classroom wherever we can. We can't necessarily compete in certain areas with other, industries, but I think it needs to be much more apparent, understandable, what the process is for getting teachers in the classroom, and keeping them in the classroom. We need to clarify rules and streamline documentation requirements to make it easier. There's still some uncertainty, like around training documentation, around attendance records, etc. So you're talking about like Brightwheel, and there's software out there that y'all can use, but we need to make sure that technology is something that we use every single day. We need to make sure that the regulations are speaking to attendance records that use where you're using technology processes. Again, so we all understand, okay, this system, captures attendance in this way. That's perfectly acceptable, provided that you're using it the way that you're supposed to. Improve monitoring, improve the investigation process. And again, that's all about supporting you all. With monitoring, with the licensing inspections, are they being conducted in a way that's helping identify what y'all are doing well, and then maybe areas that you need to be improving upon. The investigation process itself. The investigators at Health, they spin their wheels chasing after things that they know they're not going to be able to substantiate, but because the regulatory language doesn't outline specifically what should and should not be investigated, they're kind of at the mercy of the regulations. We could fix that. Also provide flexibility while maintaining safety standards. Different child care programs are, no two buildings look the same. So again, let's put things in place to ensure safety, but keeping in mind that child care centers all look different. Okay. Any questions about these?
Doing good so far.
Okay. All right. So what are the key areas that we need to address? One, the 12 health and safety requirements. We need to make sure that we've got that in there. Okay. Because I think I've driven that point home. We've got to make sure that we're meeting the federal requirements to keep the funding going. Staff qualifications and training. We need to simplify that. We need to clarify it. I talked about that. Ratios and group sizes, I do not think we need to touch ratios. I'm just going to say that before y'all start throwing tomatoes at me. Okay. I do not think, listen, I think we can all agree the lower ratios are, the better quality education that children can get, right? But we also can acknowledge that when you lower ratios, what does that immediately do, or what would y'all immediately have to do to your tuition to meet lower ratios? You'd have to up your tuition rates. And the thing is, affordability for families is something that we have to keep in mind. So in that case, affordability is going to have to win out. And then it's all about training teachers that are in classrooms, classroom management, and support for them. Okay. But group sizes have always been a pain in the what. I even remember when I was a director, the way the ratios and the group sizes, and then you throw in room capacity, it's like, well, what do you follow? Because it's different. We need to align that. Okay. Health and safety procedures, particularly around emergency situations, I think that we need to do more to help y'all know what to do in emergency cases and how to properly handle that, including when you got everybody with the Monday virus or Friday virus or whatever, spring break virus. And y'all listen, I'm not hating because sometimes I get the Monday virus myself. Record keeping and documentation requirements, particularly when it involves use of technology. Monitoring and compliance processes, I mentioned that. And then I've already said the use of technology. Okay. So why is y'all's feedback important? I'm not going to really spend a lot of time on this because I think we've expressed y'all's expertise is necessary. Okay. As I said earlier, in other industries, the people that establish how the industry, oversight of the industry is done, it's by people that actually work in the industry. Okay. So you will help identify what regulations work well and what pieces should remain, highlight areas that are creating problems for you all operationally, suggest improvements for training and documentation, and help us create practical, effective, and safe regulations. Remember, your input today isn't just being heard. It's going to be put into action. Okay?
You said it. 40.
Oh yeah. Hold me accountable. That's right. Listen, my folks come in my office all the time like, Chad, remember when you said no? I hear you. As you should, as well you should. That's right. Yesterday when I had the conversation with the feds, there's a requirement that came down, and I said I'm not changing anything until I get more guidance from the Office of Child Care, because there's ramifications that go beyond just what this one area is. So I appreciate that, and I want to do what we need to do, but I need to make sure that I'm doing it correctly. I need verification in writing that this is what we need to do moving forward. So I completely agree and respect that. Okay. So what would this process look like? So over here on the right side, you see this is a feedback loop that we have adopted with other things that we have done. We used it for our child care payment program manual update. We used it for the development of Elevate. I think it's worked well. It also holds us as an agency accountable for staying connected to you all and making sure that we're following the proper accountability procedures. So essentially it just involves this connecting, which is like what we're doing today. We're having conversations about what needs to be done. We're getting feedback from you all. What we're going to do after today, we're going to take y'all's feedback. We're going to take the questions, and then we do what we call the interpretation, which is just a fancy way of us saying, let's think about what we heard. Let's make sure that as we move forward with the process that we're using that input to guide it. Okay, that's what that means. The development and check-in, so that's where the bulk of our time is going to be. Now, y'all's role in that piece is going to be essentially critical, because as we're doing this development, and when I say development, I'm talking about the right of the regulations, y'all are going to be part of that process. Okay. Now y'all need to help us know what that needs to look like, because I don't want to overburden anybody. But y'all are very clearly, if I'm interpreting correctly what I'm hearing today, what y'all are telling me is y'all want to be involved in the writing.
Yes.
Okay.
Yes.
So I'm hearing that. I'm gonna take y'all at your word. Okay.
Don't you worry.
But,
just send what you need to send.
But again, we need to talk about what that's going to look like, because I do acknowledge that y'all have programs to run, and I don't want to overburden you. Okay. But I do want you to be involved.
But this is an opportunity to do good things.
I agree. Yes. I agree.
So
with
you
that.
just send what you need to send. We'll read it. We might not get to it immediately,
But it'll get done.
after 5:30.
Okay. Then this along with the development. So as we work on the development of the regulations, then we move into the check-in, which is like the town hall meetings.
Mm-hmm.
Okay. Now, the way that I would like this to be different than like what our traditional town hall meetings, I've run most of the town hall meetings. As we get into the regulatory rewrite, y'all know who should really be presenting the suggested changes?
Us.
Y'all, the advisory councils. So when we get to that process, I really would like y'all to be a part of it, to help with presenting what you've come up with. I want y'all to be, I mean, of course, we'll do the organization and everything, but child care providers need to see that y'all are representing them in this process. Okay. I think that's important. Okay. After we check in with the group as a whole, just like we did with Elevate and the policy thing, we're going to touch base with the provider community, say, okay, this is what we're thinking about doing. Y'all give us feedback. We'll take that feedback into consideration before we act. And this is the point that we would move to have the regulations ratified and adopted, okay, which we would go through the whole process. We would make sure both advisory councils are voting and approving the regulatory language. We would move to do the whole kit and caboodle, the public comment period, the public hearing, the filing with the Secretary of State, approval with the Board of Health, all of that. Okay. That's that action process. But we don't stop there. I think the other thing that's very important that sometimes agencies don't do really well is collect data on whether or not changes the agency has made are having their intended effect. So I think as we move forward, if we implement the new set of regulations, we need to be hearing from providers, is it working? Mm-hmm. Are the regulatory changes, are they doing what we intended them to do? Because when we get to the point where we review the regulations, because we should not just let them lay there, we do need to regulate and update the language, and just make sure that the regulations are staying relevant. We need to be using the input that we gather, share results to inform the update of the regulations. Regulations are like anything else. They should never just be a one and done thing. There's always room to improve. There's always room to improve anything that you do. Okay. Okay. So that's the process as far as the loop. You look over here on the left side, these are the 3 phases that I'm proposing. Again, this is not set in stone. If y'all don't like it, let's talk about it. But I tried to think about the bulk of what is in or what will have to go into the regulations, and how can we divide up that work so it's not just so overwhelming. Because if we just take out that 270 something page book and like, okay, let's get started, I think we're going to get very quickly overwhelmed. So instead, I'm proposing that we break down the regulations based on what they are supposed to do. Okay. First and foremost, the regulations are supposed to ensure the health, safety, well-being of our children, right? We're fortunate in that the federal government provides guidance in the 12 health and safety areas. Okay. So what I'm proposing is when we're creating new regulations, let's lay the foundation, like you're laying the foundation of the house, use the 12 health and safety areas as the basis. Okay. We take those 12 health and safety requirements. We look in the regulations where that currently is spoken for or not spoken for. That's the foundation of the new regulations. Why? Because we got to meet those federal health and safety requirements. Okay.
That is the purpose of regulation.
That's right. That's right. Exactly. And I think again, just making sure that just making sure that it's in there. And again, like I said, it's good that we have that guidance, that we can pull from. So I think we use that to lay the foundation. Okay. And if you look at also on your on your table, there's a handout right here. This lays out the 12 health and safety topics that the federal government gives us. Okay. So these are them. 1, prevention and control of infectious diseases, including immunizations, prevention of sudden infant death syndrome, also known as SIDS, and safe sleep practices, the administration of medication consistent with standards for parental consent. What that means is parents ultimately decide what medication their children should get. Y'all don't. Y'all don't say, no, we got to give this baby Tylenol unless it's an emergency situation. Okay. Or y'all can't say, we don't diagnose, or we're not supposed to diagnose and medicate children. Okay. Or when babies need to sleep, let's give them some Benadryl. Yeah, that's happened. I know that's happened.
That's one of those unlawful.
Correct. That's right. That's right. That's right. So what that means is parental consent regarding the administration of medication. By the way, y'all are not bound to give medication at all in form, shape, or fashion. If you do not feel comfortable with the liability associated with that, you can require that parents come to your center and administer medication. Prevention of and response to emergencies, especially those due to food and allergic reactions. Building and physical premises safety. This is identification and protection from hazards that can cause bodily injury, including electrical hazards, bodies of water, vehicular traffic, etc. Prevention of shaken baby syndrome, abusive head trauma, and child maltreatment. By the way, any actions that are taken that cause shaken baby syndrome are classified as abusive. Just make sure everybody understands that. 7, emergency preparedness and response planning for natural disasters and man-caused events. So this is outside of just food and allergic reactions. Handling and storing of hazardous materials and appropriate disposal of biocontaminants. Y'all, this is just basic bloodborne pathogen safety. Okay. Gloves, using proper solutions to clean, all that kind of stuff. Precautions in transporting children. If you transport children, by the way, most of the more serious violations occur when transporting children. Pediatric first aid and cardiopulmonary resuscitation, also not known as CPR. Recognition of and reporting of child abuse and neglect. And when we get to that point, we need to have a very in-depth conversation.
Yes, we do.
Because the state of Mississippi does not have any real clear indication of how that needs to be. We do report it, but I'll just tell you what happens if a situation that potentially involves abuse or neglect in a child care center. So right now, Child Protection Services, they're the designated agency. So even when it's but if it's not the parent that does it, they just say that's not our area. And so we rely on local law enforcement. And I'm not against that, but the problem is sometimes local law enforcement, they're like, we don't do that.
Right. And it's a criminal investigation.
Correct. But sometimes they don't take it up. So we need to have some conversations about that, because bottom line is our babies need to be taken care of. They need to be safe. They need to be healthy. We need to figure out, okay, how can we make sure that if we're going to rely on local law enforcement, they understand that if there's a situation, it does need to be investigated.
Well, the social worker works for you guys, right?
No.
No, who do they work for?
CPS, separate agency.
So
CPS used to be under DHS.
So how do you communicate to them that they're supposed to keep it anonymous when we call? Because they straight up tell the person. And you're like, oh, crazy.
I can give you Commissioner Andrew Sanders' email. You can get that number.
And then they have to give it up.
Oh yeah,
I understand.
But again, social worker, but CPS, they do not intervene in child abuse that is not by the parent or guardian. So if it takes place in a child care center, like if it's a teacher,
You have to call the law.
The health department.
but the health department doesn't have the purview.
Oh, no.
It's local law enforcement.
Yeah. And they don't do anything.
And then ongoing training and child development. So this is just, again, making sure that teachers understand how children learn, develop, and grow. So again, these requirements, these are minimum federal standards for health and safety. States, even though the federal government, even though they set, these standards down, Office of Child Care has made it very clear that states are responsible, however, for the implementation, the monitoring, and the enforcement of these standards. Okay. All right. So phase.
So why can't we just use that and that just be what?
Because there's some other things that need to be considered. Yeah. Okay. So phase 1 would be using the 12 health and safety standards as the foundation. Okay. Let's make sure that we have regulations that speak to this from the perspective of childcare providers. So again, there's no gray area. There's no room for interpretation. All right.
And they won't cut off our money.
Yeah, we don't. Yeah, we want to keep Daddy happy. So
Yeah.
That's right. Yeah, that's right. That's right. So that would be phase 1. We would complete that phase. Now we would not put those in place, but that's where we would start. Okay. So we would complete phase 1, get feedback from the overall. Y'all are going to be heavily involved in the writing part. Then we would get feedback from the provider, the public, providers, families, etc. Make sure that we got that part good. Okay. Then we would move into phase 2. So phase 2 would be additional regulations, including like capacity. I know there's heartburn around the way rooms are measured, not just from y'all's perspective, but also from the licensing officials. We need to clarify. One of the things the licensing official said, it's too confusing because you have different room, like there's one measurement for when children are awake. There's another when they're asleep. It needs to be very simplified. Okay?
But it was adopted in a deceptive way, and these people did not do that. They've been left to pick up pieces. That's not fair.
Correct. Yes.
But
so we need to simplify it and adopt a capacity aesthetic.
in fact, we don't even have a set square
footage. We don't.
When we think about it, we don't even have it.
And the licensing officials, they agree. They agree with that.
Oh, I'm sure
they agree.
do.
Yeah.
I'm sure they got it. They state measures.
So when we're looking at capacity, like when we're talking about supervision, there's things around supervision that are unclear what constitutes proper supervision. The background check process itself, I know that there have been some things that have been in place to try to fix it, but I know some of it's not working really well. So have a conversation about that. And then menu planning is a big one. My suggestion around menu planning, we use like My Plate standards, but we get away from all of the vitamin E, vitamin D, whatever. I think that we focus too much and again, missing the forest for the trees. Okay. There's nothing wrong with feeding them kids some chicken nuggets. I'm sorry, but that's just
because that's what they're used to eating.
They're going to eat it at home anyway.
As long as you're introducing some vegetables and yes, give the baby some chocolate milk.
Yeah.
Okay?
Yes.
I love chocolate.
When we reach that point, can we coordinate with the child nutrition program?
We can if the child nutrition program will work with us. Because I've historically had some difficulty getting any kind of response. And Miss Sylvester, if you know somebody over there that'll get there, that by all means, yes, we're going to tap into your connection.
Okay.
Yes. If you can make that happen, you can be my BFF. I'm sorry.
With the nutrition agency, and we could talk about this, but it's been understood that they have been working with the health department on this. This is what they're telling us.
I think to a degree, yes, but
they have.
But then too, even with them working, they do have one set of standards, and
It's two different sets of standards.
And so it would be good to get them together because it drives us crazy.
Insane. That's what we're working on.
okay. Well, again, when Office of Child Nutrition and Department of Health, when they're having conversations, are y'all also at the table?
No.
Because I've also known there's conversation, and this is not the Department of Health, but I've also known that there are meetings around the guidance with CACFP. And it's my experience, the Office of Child Nutrition doesn't do a lot to support childcare with onboarding childcare with the CACFP program. And the CACFP program could represent a very strong financial support for childcare programs if it was properly implemented.
Yes.
But it's not.
Well,
So
if you apply unless you've got 3 positive months, and who has positive months right now? 3 in a row.
Yep. So again, conversations around menu planning. So phase 2 would be more state specific things that need to be included. Okay. So phase 1, making sure we're meeting those federal requirements. Anything that is not really spoken to in the federal language that we need to address in phase 2. Okay. So these would be the state specific things. And again, this is really where this is again a primary opportunity for us really to talk about what's reasonable, what's rational, both from y'all's perspective and from licensing officials' perspective. Make sure that, again, there's no gray area, that everybody understands what the requirements are. And then phase 3 would be addressing corrective action and the investigation process. This is probably where I would suggest the most change. Some of the suggestions, and these are just suggestions. Okay, so even though I'm being recorded, these are suggestions. This is not okay. This is just Chad's thought. Okay. First up, on the investigation process, to help Department of Health not spin their wheels, I think we would need to establish what will and will not be investigated.
Right. Yes.
We talked about laying out what would be considered grievances that need to be handled between the parent or employee and the owner of the child care center.
Yes.
And then those things that Department of Health would actually investigate.
I would be very curious to know how many times they've been called to address a complaint from a parent who has not paid their bill.
Yeah, you tell them come back. Yeah.
So again, I think we would establish what the Department of Health would and would not investigate. Okay. No more spinning their wheels, and no, just because again, well, they served the babies chocolate milk this week. We're not going to go investigate that. Okay. Now, if teachers are drinking on the job or brandishing weapons in the child care center,
Yes.
yes.
Give a hand. Give a hand.
Carol?
So Chad, will all 3 of these phases be completed before a set of regulations is finalized and taken to the board?
I think so, yes. I think
So they wouldn't be taken one at a time?
I don't think so. I think we would need to present them as a full set. Yes. It's just the 3 phases they did just to kind of break it down to make it a little bit more doable.
And have you thought about a time frame?
That's what we're about to talk about.
I'm gonna tell you, it's gonna be 3 meetings.
So then looking, so that's the investigation process. All right, corrective action. Hang with me, okay? I propose because what I think when you're looking at the corrective action process, I do not think that the practice of assigning monetary penalties is really doing anything to correct habitual violations. Okay. I propose that except for class 1 violations, monetary penalties be removed. In place of monetary penalties, we would adopt a progressive enforcement model that would more heavily involve technical assistance and coaching on the front end, give providers the opportunity to correct the action, but then at the end of the day, instead of moving to monetary penalties, if the provider, after receiving assistance and after being given an opportunity to correct their action, if we're still seeing habitual violations, then we move to either restrictive, conditional, and then ultimately revocation of license. Okay. Now, for class 1 violations, I think we need to take a look at those. I think we would probably need to establish levels of class 1 violations. And I'm going to tell you, this is another thing. I've been in a couple of situations where I saw, and I mean, when I saw video evidence because of the lack of action of staff at a child care center resulting in the death of a child. Okay. It is insulting to only assign a $500 penalty for that. Okay. I think the level of the monetary penalty is not high enough when we're talking about preventing the death or dismemberment of a child. That it's not, I think it deters. I think we need to raise the level.
It needs to hurt.
Yes, agree.
I mean, you would think the loss of business would be the hurt. For sure.
Well, in the revocate, and I think we also need to determine, because right now, even the way the regulatory language speaks right now, even if, like in this case, there's video evidence that shows that a staff member failed to prevent the death of a child, and I'm talking about being 5 feet away. The way the regulations write, a provider is still allowed 2 of those over the lifetime of their license. So again, we need to have discussions about it. I'm not saying we solve that today, but I do think that the way the current corrective action is listed in the regulations, I don't think it's really doing much to help improve overall, across the state, because y'all know there are some providers, especially those that undercut y'all. They go in and they're cited for being, grossly over ratio. They're just going to write that monetary penalty check and keep going because it's cheaper for them to load up those classrooms, have, 50, 60 kids in a room.
They can pay that.
Oh, yeah,
They can pay that fine. They still benefit.
Correct. And again, I've had conversations with, the licensing folks, and they're frustrated too because they're kind of limited with the way that they can cite situations like that. Because when they go in and it's like that, and it's like that, and it's like that, and they're steadily writing up this center, but then the center's just paying those monetary penalties. Because there's the thing, paying a monetary penalty is seen as getting in compliance.
Yeah.
Okay. Even if the center is still not doing what they're supposed to be doing, a hearing officer, if they see that they paid their fine, the hearing officer is going to say, well, they took action to correct it.
And some of it's going to be a criminal investigation, and that takes the health department out of it. They have to wait for those results.
Yeah.
And some of it's going to require due process law.
Yes.
But that can be written in.
Yes.
And then they know what to do.
Yes, 100%. Yes. Was there anything else I left out with suggestion wise? So those are just some examples. So that would be phase 3, like really looking at how phase 3 would focus more on how Department of Health is overseeing the enforcement of the regulations. Okay. And then again, we would complete each phase before we move to the next phase, and we would present the full set of regulations as a whole. We wouldn't send each phase. We wouldn't send like phase 1 for the Board of Health review. We would create all 3 of these together would create a full set. Yes, 100%. Okay, so timeline wise, we don't need to rush through the process. We need to make sure that we're doing this correctly. But I also understand that we don't need to belabor the process. Okay. So I think we need to have a conversation about what you all think would be reasonable in terms of setting a goal for the completion. I think we need to say, okay, this is our goal for the whole set, and then kind of back it up and say, okay, so we would complete phase 1 by this date, phase 2 by this date, phase 3 by this date. What do y'all think? So what do y'all think would be, considered reasonable for us to get this completed, the overall thing?
So this is April.
Mm-hmm.
And it's 200 and how many pages?
Like 77, 78, something like that.
Yeah, but we're not going to take that. We're not using that one.
No, the reason why I was saying that is because if we, I hear you, Carol. If we took We're not gonna go line by line. So I think that what is doable, with the first phase, if it would take maybe, me and Debbie already said, we think 3 meetings if we broke everything down, but the first phase, if we have another meeting for 2 days for the first phase, and then the next month, take phase 2, 2 meetings, and then finalize phase 3.
3 or 6 meetings.
Yeah,
I would just-
6 meetings.
You might need 2 meetings.
I think y'all might.
For each phase
I think y'all might
together.
need more, especially for that first phase, because that's a lot of ground to cover. So it's that.
Health and safety.
I'm sorry.
12.
All the way.
You know I can do.
So yeah.
I think 6 months would be external support that you can contract. I mean, I'm just wondering, we're not going to like, right?
Yeah, so I actually have 2 people. I have 2 people that are going to be dedicated full time to this project.
Okay.
Lakeisha Bland and Crystal Carter. So they're going to be facilitating this process with them.
And there are some sort of national.
Oh yeah. Why? And I have access. Yes, 100%. I actually, so our federal partners, there is an entire TA team that will provide assistance as well. And yes, 100. Yes, we will get their help. Yes, 100%. So again, y'all, I think we will have like the meeting. I think we will have the meetings, but there will be homework in between. Okay, so like I'm thinking, like with phase 1. We will say, okay, we need y'all to go look, comb through the regulations right now, see if you can find regulations that speak to the current health and safety topics that we could borrow language from, but we're not going to dive into the current regulations and strike through. We're not going to use this. We're going to use this. We need to find what's in there that speaks to the health and safety topics. Again, we're creating a new framework or a new foundation, not like I said, not striking through the other regulations.
Well, we can't the federal requirements, we do have those.
Yes, ma'am.
So we know they automatically go in there.
Yes, ma'am.
Okay.
And the CCDF state plan, it will be a good guidance document as well, because in the state plan we write to how we will address the 12 health and safety.
We send all of us an email with the document that we're going to go by to be able to do the phase 1. So that way everybody is singing from the same sheet of music, utilizing the exact same document. And then maybe from there, since there are 12 periods, would you consider like breaking it up?
Yeah,
To
I think maybe
like 2 or 3
yes.
people are working on this area together. So that way we can cover more ground. And then, when we come back, then we already have somewhat of a draft for you to kind of look at, go through, and then we can be productive.
So would y'all be amenable to that if we took the members of the advisory council and we developed work groups that focus on specific topics? And then what we would do, we could break it up. We could have smaller groups that would work on specific health and safety topics, kind of get everything written out, and then we would come together as a larger group to review and approve the collective work of the work groups. Y'all got that?
Get a lot
Yes.
of cover
Okay.
in phase 1
Mhm.
in a more timely fashion to move into phase 2. Then after phase 1, and we do that, we come back together for a day, look at it, comb through that, see where the gaps are, what we need to go back and look at. You take it back, then maybe some of the TA group or what have you can look at it to make sure we're on the same page.
Yep.
Before we say, okay, are we ready to move to the next phase? Then look at what that timeline of how many days we'll need for that.
Yep.
To be able to move forward with that. So that way we're being intentional
Right.
in covering every area and everybody, having some feedback to be able to provide.
I think phase 1 is going to take the longest.
Yes.
Phases 2 and phase 3 are going to be, they're still going to take some time, but we have to cover more ground with phase 1 than we do in phases 2 and 3. Okay.
6 months.
So we're saying like 6 months for phase 1. Okay. So why don't we do this? Why don't we set that as a tentative deadline for phase one? And then once we complete phase one, we could set goals for phases two and three.
No, those would be easier.
Okay.
2 and 3, because the foundation will already be in place.
Okay. All right. So what I'm hearing, I'm interpreting here. So what I'm hearing is we're going to focus on phase one. We're going to set a goal of 6 months to complete phase one. Y'all as a group are saying that you think it's a good idea for us to break the membership of the two advisory councils into smaller work groups to focus on specific topics within the 12 health and safety pieces. Y'all would work with Lakeisha and Crystal on writing out the language in those topics. Once that's done, we would come together as a collective group to review and approve the work of the.
Can we make sure in every single one of those groups that a owner isn't a facility owner isn't?
Yeah.
It has to be.
Okay,
One for each group.
I think we have enough representation. We have enough representation with the two councils to
spread it out.
100% make that happen. Okay, so y'all think that's a good.
Yes.
Those are good next steps. So so that being said, I think what we'll do is, and we will also, so Lakeisha and Crystal, of course, I think it would probably also be a good idea to have representation from the Department of Health on each work group, at least have someone just to make sure that they understand the process and they can give input. Okay, so the next step would be to assign people to work groups. I don't want to try to do that right now because I think it would get nuts. So I think what we will do is once we get back to the office, we will kind of outline this framework. We'll contact advisory members and see what groups y'all would like to work on. But y'all just keep in mind, we will need to make sure that, as you said, we want child care representation on each group.
Jason, I'm thinking, can you do that by just breaking it out into the 12 topic areas, send it out to us like as a poll and say which one, and then
We'll do it like a potluck sign up.
Yeah.
All right. What you bringing?
Yeah. And you don't have to representation. Put how many slots you want on each group.
Yes.
Knowing how many people serve on each. And then if it's 3, it's 3. You only have 3 slots. You need to move to another area.
Yes, I agree. I don't think anybody needs to be on more than 2 or 3 topics. Yes, agreed. But I think we would do it by individual topic. Yes.
Yeah. Yeah. And then put that language in there. Really don't serve on more than 2. Whatever the instructions are, and then everybody can sign up. And then you have those blocked off that are for health department to sign up, and then whoever else of those mandatory spots that they will serve on there.
Agreed.
Just a thought.
Yes. No, I think so. We would have the 12 topics listed out again, like potluck. Y'all sign up for, which groups y'all want to participate in. Just keep in mind that we will need to, again, make sure that we have provider, representation in each group. So we may ask you, hey, do you mind moving over to this group? And the department. Yes. And the Department of Health will work with y'all to get a Department of Health representative on each group as well. Okay.
So some of it, nobody gonna want to
So the town hall meetings won't happen until group phases are.
Correct. So I think what we would probably do is after we get when we get this written, we would use the town halls as the opportunity to present what the councils have created for feedback before we move to the next phase. Yeah.
And as we work, we can reach out to any others that we think we may know that can
give
input into this. And also, will there be a leader for each group so that we can stay on some target and get our work done?
Well, so that's what Lakeisha and Crystal, they'll be coordinating. Like they're going to be helping y'all make sure that you're meeting and that you're on task and everything. Yeah. Okay. I do want to. So anything else? Any other thoughts about these 3 phases? Carol, do you feel a little bit better?
I agree with you that we need to do what we need to do to keep CCDF funded. And so it's a high priority. And I'm not even sure what role the advisory councils could play with regard to revenue. It's just the need for revenue is so critical right now.
Agreed.
Maybe it can be a topic in our next meeting's conversation if we're still up against a brick wall on that. But I feel like, your reference to CICFP, for example, as a potential revenue stream, there could be something there that we might be able to do to make that an easier revenue stream for child care centers to take advantage of. And there may be other things, but because what we're needing right now so desperately is additional revenue, it just feels like as an advisory council on the sector that's falling apart right now, it's an issue that we need to do something to address.
So I think I agree with you. I also think that we've needed
revenue a long time.
Correct. And
yes,
we've also needed to provide ways for you all to network better with each other and have discussions. I think this might provide a natural avenue for some of y'all that don't really know each other to
work together.
Really start networking and really start getting to know each other and how you all can support each other and be more of a unified voice to have those types of discussions. And I think as we're working on this, like when we're talking about like background checks, I've had several people say that it's difficult to afford background checks because of the turnover. I think as part of the discussion with that, we could have discussions. Okay, what are some avenues that maybe we can help with helping child care providers pay for that without it coming out of their own pocket? Or like with the menu planning, how can we get CACFP more heavily involved? I feel like this might be an opportunity to bring people into the table. And this will also, I feel like, help give the advisory councils, particularly Department of Health's advisory council, some direction that you've been lacking. That's just kind of my thought on that as well. So, and again, I feel like this will be time well spent. And I think that there will be some conversations that are going to, and I think some other funding opportunities. I think we're going to get more creative, but also more specific in ways. Yeah.
Is the 6 month, is the timeline that we were just discussing about those 3 phases going to be adequate to respond to the federal compliance issues?
Yes.
Okay.
So there are a couple of things that we'll need to address, quickly, and we'll probably need to update the current regulations, but we need to do that as part of this process. Okay. Right. One of the big ones was about training around health and safety. We address it in the child care payment program manual, but that was one of the areas.
David? I just have one quick question. The biggest concern I have heard about what was filed with the Secretary of State that we object strongly to was we know it's federal law, the emergency evacuation plan and for natural disasters and man-made disasters. I hope we don't get nuked between now and then, but they're requiring a backpack with diapers, formula, this sort of thing, snacks, etc. And when does it? They gave us until May to have all of this completed and ready and whatever. What is the federal deadline for compliance with that? Or is there a deadline?
I don't know that the backpack specifically. I mean, there's basic supplies that in certain situations, but the feds,
we have no money. I think
we don't have
anyway. So
in the state plan, we just say that you have to have an emergency plan in place. As far as the specifics,
they want diapers, formula, snacks, files, change of clothes. I haven't read all of it.
It's a lot,
but it's all due by May. So people are coming up for relicensure, and they don't.
Keisha, I need to bring that up with Sharita and Anna. Will you make a note of that because the state plan doesn't have all that. So
Well, we should have particularly in how this was filed, we should have until next May.
So I remember,
to complete that.
back, when I was teaching directors credentialing, so we had different types of emergencies, and there were plans for the different types of emergencies. Because here's the thing: if the building's on fire, you got to get those kiddos out.
Right.
Okay. And again, with what's reasonable, rational, let me just double check with our federal partners on, we'll look at the emergency plan and make sure we're all on the same page.
Because there's several facilities that they don't transport at all. And they have it in the plan, like where's your alternate facility? How are you going to get in there?
Well, so you do have to. You have to have a 1 mile and a 5 mile, but that's like if there's a fire or a gas leak or something. But it doesn't necessarily have to be another facility. It just needs to be somewhere safe. Where you can have the children gathered, and then you can get parents to come get the kids as soon as possible. It's not designed to be. So you have to. So what I would say is, you need to have a plan in place with your local emergency enforcement,
emergency management agency.
Yes, you need to get a plan. So, for example,
we have that, but we have 3 buses at each site. I'm talking about every other owner in the city that they're running preschool and they're not transporting kids anywhere.
So again,
that's their complaint, really.
Correct. Again.
So, transport.
So what they're talking about is the emergency transport of children. It's how do you get them from point A to point B. So if you don't transport, again, you need to you have a couple of options. You can have something in place with emergency management. That would be my first thing. Excuse me, because so when I was director, I was up in South Haven, and so I had a it wasn't a contract, but I can't remember what the city called it, but I had 3 fire departments. And at any point that we had to have an evacuation where I had to get them beyond, we had a field across that we would take if the building had been on fire. But if law enforcement, if they say there's a gas leak or whatever, emergency services, they're bound by law to assist with evacuation. Mm-hmm. So I had 3 fire departments that were all on call if we needed to evacuate, and we called
it's good to have an answer now.
Yeah.
That's what they're all asking me. I'm like,
these fire departments, they had transport, it wasn't a fire truck. I wasn't loading the kids up on a fire truck, but they were buses that they would bring. But listen, EMS is set up different in different ways, but if you do not transport, again, if there's a situation where you have to evacuate the area, so if there's a fire, you need somewhere immediately close by. Okay. Again, we had a field across, and it was actually the backside of a church that was across. That was our fire plan. Okay, we get the kids out of the building. But if it's a situation where you have to go to your 1 mile or your 5 mile, more than likely that's something like a gas leak or something at a higher EMS services. They are required to assist with evacuation of the area, and particularly if you have a vulnerable population, whether it's children or elderly that are not mobile. So I would tell your child care folks, reach out to their fire departments, their whoever. And I will say, it's not a bad idea for your child care folks to gather together and go to a city council meeting and say, how is the city? We have kiddos that we can't back. So in case of evacuation, yes.
Well, it would be the thing that you're talking about, that if we write this up, that's listed, because I've been doing some research and I know FEMA will do some training.
Mm-hmm.
Yes. And we need some training to even implement this stuff. Because we can go through and read, but we really need somebody to tell us what is actually required and how to accomplish it.
And that may be, hey, Keisha, Crystal, we all write that down too. Let's see if we can't reach out to FEMA or MEMA about looking at if we can coordinate some training for everybody.
Chad, I would ask that you use all of your charm and all of your intellect and even your checkbook to encourage childcare licensing with the Mississippi Department of Health to remove the deadline for this May, which is 7 weeks away, when they only sprung this adoption that we knew nothing about just a few weeks ago. So I think maybe next May. I don't know what the deadline is, but I do know this. Dolores and I were thinking that backpack, if that's what they're requiring, if it costs every child care provider $100, they have to do an economic impact study. And I don't mean the short. It's more than $100. If we go to court, we're gonna ask for
It's $1,000.
Yeah, it's more than
It's
$100. Dolores, if we go to court, we're going to ask for the long form, not the short form. Yeah. So we just have enough.
So,
this is just nobody has any money.
We don't.
And
was it a backpack per child?
I've been it's for the
It's like
it's
for the
classroom.
Each classroom.
We'll look into that. Okay. All right. So back with this. Are there any thoughts before?
And we're not against it. We know it's a federal law. But
The federal law is an emergency preparedness plan. I need to double check on backpacks.
But now those unfunded mandates from HHS can also be challenged. I have long thought they needed to be sued.
Well, the other thing is right now at the federal level, I need to say this, and then I really, because we're getting close, I want to be respectful of everyone's time. We do need to allow the public for public comment. I agree, and we're still waiting on the feds to release the updated final rule because they rolled back some of the elements in the final rule that came out in 2024. So in 2024, there was the reauthorization of CCDBG. The feds are rolling back some of those requirements, and we're still waiting on the updated final rule to be released by OCC.
Public hearing be held.
They already had it. The MPHS. Mm-hmm.
Did they provide notice to child care providers?
I didn't get through them all.
Okay, moving on.
Okay.
But y'all need to research that. Y'all research that. I will say what they're looking at rolling back is probably good. It's in at least the major requirements are a good thing, I think. But yeah, y'all can research that. Okay. Anything else on this before we open up for public comment? I would say we take a quick break, but I mean, we're getting close to time, so I would rather just open it up.
And so I'll send a message for you to please check the chat.
Okay. And I will, because I'm gonna see. Yeah, I'm not gonna answer questions about policy. I'm not gonna answer questions about the current policy. I mean the current regulation structure. Okay. We are going to take. We will look at the comments that are in the chat. At this point, I am going to open it up for public comment from the public. If you would like to make public comment, if you will put your name in the chat and say, and we'll allow you, if you'll put your name in the chat, we will unmute you. Yes.
Want to ask Regina, since she's on the council, what she had to say? Because she never was addressed as a council member. I saw that.
Yeah. So, Regina, do you have any comments before we move to public comment?
Honestly, not anymore because I done forgot what I was going to say.
Okay.
Hey, this is Matt. I would like to say something.
Hey, okay, man.
Hey, thanks for the meeting. Looking forward to participating in the process. I wanted to say if and when the opportunity to discuss any legislation that pertains to moving licensure to the Department of Human Services, that would also mean this advisory council falling under the Department of Human Services. I would like to be part of what the, some of the proposed language that may go into that legislation, specifically around the advisory council's role. And I think maybe considering strengthening some of the language around the advisory council's oversight of regulations. Thanks.
Sure. Thanks for the comment, Matt. Okay, any other advisory council members that are joining us virtually that would like to make comment before we open it up for public comment?
Hey, Chad, I just remember what I was going to say.
Okay.
I was wondering, I think you answered the question, but I'm not sure, but we're basically going to start with each topic and borrow language from the old regulation, but we're not going to try to manipulate the words. We're going to basically start a whole new document, right? Because I feel like it would just be easier to take each topic and say, okay, this is what we're supposed to do. Now let's build a regulation off of that and just forget about the old one.
Yes, that's correct. Yes.
Okay. That's what I was going to say.
Okay. Any other advisory council members that would like to make comment before I open it up for public comment? Okay. Let's see. All right, Lisa, I saw you had your name. Did you want to make public comment? Lisa Daniel? Oh, I see. Okay. You should be able to unmute yourself now. I changed the setting.
Thank you, Chad. Great meeting today. I appreciate you including everyone and keeping us all abreast and being very transparent. I'm very excited about the process that you've outlined and look forward to the work. I just had one question. Is there any way that providers who are not on the council can be emailed or whatever's the easiest method, like some of the drafts? Because I believe in small segments, it's easier for us to process and kind of think through the implications versus getting a set of those 12 regulations, the health and safety requirements, those 12 items. I feel like as the town hall meeting and we're given that one document, that one section of the document to review in a short time, I don't know that we can reflect on it and think about all the implications that could be possible. So I just wanted to ask that. And then the other question that I wanted is, would it be possible to give
just
us,
a second, Lisa. Hey, if everyone else, if you will mute yourself, if you're not speaking, please. I'm getting some feedback from another participant while Lisa's speaking. Thank you. Okay, go ahead, Lisa. I'm sorry.
Okay, thank you. Just real quick, if we could all get some clarification, I know you don't want to talk about the current regulations, but that emergency and the backpack and what we do and don't, can we get that to all providers whenever you get the information, Chad? Was just asked about that at my March inspection, and I'm not really understanding what I need to do. So if whatever you find out, if you could just send that out, however.
Yes, we certainly will. Yes.
Okay.
Regarding your comment, yes, and I think regarding your comment about getting the information out in smaller sections, I have a couple of ideas about how to do that. I think frankly, I think I mean, in my opinion, even the individual groups that are meeting, the individual work groups, those are public meetings as well. So you can listen in directly on these meetings, but I think as an additional step, I think as the work groups complete their individual sections, I think we would send out those individual sections ahead of time to let y'all have to review before we do the town hall meetings.
Oh, Chad, that's great. Where will we find the information about those work group meetings?
So we'll send those out. We'll send those out via our listserv. We'll send those out, obviously, to the advisory council members. We'll ask Department of Health to send it out on their listserv as well, and then it'll be posted on our website.
Thank you.
that we filed with the Secretary of State was that they had violated, the Department of Health had violated the Administrative Procedures Law regarding the list of interested parties that had requested information in the event of fair rulemaking, et cetera. Anytime that there's a recommendation to amend policies or whatever, these people have signed up and said, I want to be informed, I want to be a part. Now, there is a list of interested parties that had been kept by Festus Simpkins for years and years and years and years at the Department of Health. I don't know if anyone has even asked for it since his retirement, but the Administrative Procedures Law does require that those persons on that list be informed by direct email or as some kind of communication some way. And you can do that. You can start a database too if you want to, and have providers to sign up. Say, look, if you want to know when DHS is considering or holding committee meetings or blah blah blah, and then you'll know who to send it to. I would probably send it to everybody as Lisa suggested, but the health department's already supposed to be sending it to that list of interested parties, to that database. That's the law.
There's a comment about how does the advisory council plan to get feedback from owners and directors in the field to use when they recreate these regulations, so we can share big issues and needs we have found with them. So again, the individual work group meetings will be public. You'll be able to give comment at those meetings as well. But I do think that, I mean, if there are any suggestions, about the regulations, I'm hesitant to say email me because, but I do think that advisory council members, how would you feel if once we assign the groups, if we sent that information, your email addresses?
They can. That's good.
Yes, and let them contact.
Okay.
That'd
Okay.
be less of a headache for you guys.
So we're actually representing them.
Right.
So they can contact us so we can send them information.
Okay, so the suggestion is that when we assign the work groups for like the health and safety pieces, we will send out the information, the members of the council that are on those work groups, their email addresses, and you can send suggestions directly to them.
And they can also attend the meetings. They have to wait till the
Correct. Right, and you can correct. You can attend the meetings and listen. Yes. Anyone else that would like to come off mute and make public comment? Lisa, I see you put Cantrell's name. Cantrell, did you want to make public comment?
Yes, thank you so much. And I also wanted to commend you, Chad, for taking the reins and pulling these groups together in different communities and entities of early childhood so that we can all be on the same page. I was just, I had made a comment to ask the same thing, the question that you read, but I was going to say, are you going to have a leader of each one of these committees? Maybe we could just email that one person who's going to be over the committees, and then that way that person can communicate to the work groups. We could just email whoever the leader is of that work group.
I mean, we may potentially assign leadership for each work group. We could have, someone that kind of takes point. But I will say, so I have 2 staff members that are going to be involved. You can email them as well as any of the members on the work group. Y'all are welcome, by the way. Not,
Thank you.
I'm talking to my staff members there.
They're so happy to learn that.
Thank you so much. And I think that would probably be an easier way if you just have that one key person, and those of us who are, currently in the field and out here working, we can do like Lisa suggested. We'll have an opportunity to read over those things and have a chance to make comment also. Thank you so much. Thank y'all.
Sure. Thank you.
Hey, Chad.
Uh-huh.
I was on mute earlier, but I'm the center that floods. And so we've had to be evacuated twice.
In regards to that question earlier, EOC in Rankin County, which I know we're all over, but they will get you out and they will provide transportation. They have
Okay.
it. They have many, many means. They can access school buses. They can do way more than what we probably give them credit for. So, I would just suggest reaching out to them. Unfortunately,
Okay.
I'm speaking from experience.
Well, and listen, I appreciate it. I mean, the experience like that and advice like that is invaluable. So thank you for
Yeah.
sharing. Yeah.
That also applies to Lee County too. The Tupelo area. Yeah, because where the fire departments and the schools are, they allow that, and they've built other shelters, new shelters. So
Okay, I'm just making sure.
Lee County, Tupelo area.
Let's see. Just making sure that there's no. Is there anyone else that would like to give public comment before we adjourn? Okay, Lori Hodge, I see your name. You can unmute yourself and give public comment.
Okay. Thank you, Chad, for everything that y'all have done today and all the hard work that everybody's put into revising our regulations for the better of the children and our child care familyhood. What I'm gonna ask or actually make a comment on is a situation that we had on safety just a while back with an employee. And I had to turn in a report to the state on this employee, and it was advised by Mr. James Bryce that I get on here today and voice my opinion on the situation that's very concerning. There's nothing in the regs that protects the children in this situation that happened or the facilities. I know I'm not the only one that this current situation had happened to. And I think he told me, Mr. Bryce told me that it has been addressed, but nothing has actually been put into play. Let me tell you the situation. Had an employee on her very last day had already given me her 2-week notice. Nothing had happened in the past that would cause an alarm or eyebrows to be raised. I had a parent call me. Well, let me go back. The last day of the employee it was on a Thursday. Friday, the parent called me late that afternoon, extremely late, saying that her daughter had told her the employee had pinched her. And that she knew her daughter had, has a mind like a child. Maybe that wasn't true or how it happened. So she waited late that night and she asked the child again. Apparently the child told her the same thing. The child is 4 years old. That Saturday morning, she asked her again. She said she was going to ask her again and she would let me know what she said. So Saturday she let me know and it was the same story. So I told the parent that I would review the camera on Monday. I reviewed the camera on Monday, zoomed in on the employee. Indeed, that did happen. The employee was already gone from our facility. So made a report on this, and there's nowhere in the regs that says what do we do. Like the parent, I told the parent she had 2 choices: to report it to the state, number 1, and number 2, she could press charges against that against that employee. The parent chose not to do that right now because of the situation that she works for us. And so my question and my concern is, what can we do in the future to protect these children? And there's got to be something that we can do. Like when that is being a grave concern that it happened and the employee is gone, but you're being aware of it, we should be able to or the state should be able to do red flags on employees. Now, let me tell you the concern. She does not need to work in a child care facility anymore, but because there's nothing that is legally done to put her on a list with the police department, with pressing charges and going to court, and found guilty, if that may be the case, there should be a system in play to where she could be red flagged. And so that if I'm going to hire someone in the future, I should be able to go to a site, look up that name if that employee's there. I know it's a legal thing, but there's got to be something we can do. And if that person's name on there, then I, as a facility, have the choice not to hire her if I don't want to, based on she's got a red flag there. If I hire her and something happens in my facility on the same basis of what happened in the other childcare facility, there should be some kind of system put in to where either we get shut down and investigated for 6 months or closed down.
So, Lori, I hear what you're saying. This has been something that has come up several times, particularly, so there's a couple of things. There's a couple of factors to consider here. One, someone has to be convicted of something before it can be held against them. There may be some other options. I will tell you, Department of Health has advocated for, and this was even when I used to be an employee of Department of Health, Department of Health advocated for our legislator to pass what's called RAP back for employees in childcare, and the legislature has not picked it up. What RAP back does is when someone is fingerprinted and they're in the system, at the point that, because here's the thing, there's a 5-year period between fingerprinting. And so what RATback does is if at some point someone is convicted of what we call a disqualifying event, which would disqualify that person from working with children, Department of Health would have received immediate notification. The problem is we don't have RATback in place. Our state, they picked it up for medical marijuana, but they didn't pick it up for childcare. So just that's something that could be considered. As far as what else can be done, we have to be careful because agencies, like with posting information, you have to be careful because you don't want agencies to slander anybody, someone that is not actually convicted. But we have a sex offender registry. I feel like we should. Same for child abuse. But again, the question is, how do we get the information back? So I'm sorry, I don't really have a simple answer for you. I do think RATback is something that should be passed for anyone that works with children, for any industry where people work with children. That would definitely be a step in the right direction.
Well, Chad, what can we do as a child care community that we can push this forward? Is there anything, petitions or anything that we can put into place?
If there's a conviction, if someone is actually convicted, that's a different situation. And we can, I think that we could definitely have further discussion about, what could be done, in the industry, at the industry level, if there is actually someone that is convicted of abuse, neglect. If someone has just been arrested, though, unfortunately, that we have to let the court system play out. They are innocent until proven guilty.
From my standpoint, as a child advocate, I've been in this business for 40 years. I don't play when it comes to stuff like that. Had she been still an employee of mine, she'd have been fired immediately. This is not my facility. I don't own it. I work for someone else. But if it was my facility, I probably I would press charges against her. But that's not the case here. But there's just got to be something better that protects these children. There's like a loophole here that there's got to be some way we can fix it. It's our job to.
No, the law is already in place for that, Lori. It's called due process of law. All men are innocent until proven guilty in a court of law. And
if I've got a video showing that she did it,
you turn it into the police.
And I think what she's saying is, though, even so, I agree. If there's a conviction, y'all cannot keep someone that is convicted of abuse or neglect.
Right.
Your payroll.
Absolutely.
You as the owner, you can terminate we're an at-will state. You can terminate anyone for any reason. But I think the other issue that you're raising is if an employee is terminated from a facility,
yes,
what's to keep them from going to another facility? And even if they are convicted right now, if they're within that 5-year period, there's really no surefire way to ensure that someone that is convicted isn't employed in another situation. I think that is a loophole, because again, if someone is convicted of abuse or neglect, they're no longer considered innocent, by society. So
This is in place, press
Yeah.
charges or leave it alone.
yeah.
Well, and I would say this, being a part of a family, as we're trying to do, we can call one another and ask. If she applies somewhere else, I know a lot of times an employee will leave one center and go to another, and we're just hiring a lot. I get it. But sometimes if they worked in childcare and they've left one center to go to another, it's probably worth making that phone call.
Yeah.
Center to
It is.
center,
It
communicate
definitely
with one
is.
another.
Absolutely. I 100% agree there. And it's their choice whether they believe you or not. And it's their choice whether to hire them or not after you give them that information. But that's the only way we can protect these children is if we work together.
And at the end of the day, you can just say, I don't recommend her to work with children.
And
Because you
that's
can't
what
really disclose what
that's what I
happened if
do.
it's liability.
Where y'all, I will say this, and then we need to move on to other public comment. Another very easy thing that you can say is this person is not this person is not available to be rehired at my center.
Yeah.
You could just say that.
Yeah.
You could just say that.
I appreciate
That's
every
fine with
single
me.
one of y'all. Thank you for your help. And every day, y'all do an amazing job. So thank you for your time today.
Thanks, Lori. Okay. Anyone else that would like to make public comment before we wrap it up?
Chad, this is Shirley Hampton, and
Yes, ma'am.
I want to commend you for taking on this project. I really feel good about it, and I can see some good things coming from it. I have probably two concerns that I have. One is I've had situations to happen at my center where the parent and we were able to, come to an agreement or whatever. And then because it was an incident that took place and I reported it to the health department, they came out and did an investigation and I was fined. Even though the parent did not make a complaint or anything or whatever, but because I reported it as an incident, I was fined. And I don't think I didn't think it was fair that, it was like you do or die. But
So I
either
think,
way, I was going to be fined. If I hadn't reported it as she did, and my reporting it caused me to be fined. And I didn't think I don't think that's fair.
so I've had conversations again, about self-reporting. We do not want to deter self-reports. And again, the current regulatory language doesn't allow the licensing officials to not self-reporting and not being fined for self-reporting is not spoken to in the current regulations. I think that's something else that we would need to address in the updated regulations. Yes, ma'am. What was you said
Okay.
what was your other concern?
My other concern is dealing with parents and issues dealing with personal situations with parents that somehow or another end up at the daycare center where uh, the parent, one parent wants to get the child, the other parent does not want to get the child. We had one parent that signed the child into the center, and we end up in not trying to figure out who can go. Then the police is called, and they say, "Well, you can't keep the child from going with the parent." And we said, "Well, we have this parent does not sign the child in." But I got my paper here saying that I am. It just such. It gets to be so confusing that we're in it. And I always suggest to the parents, you all need to take care of this outside of the center. But she won't let me see them. But we end up in the middle of it. And I would like some clarity as to how do we handle it when you got this parent over here with a custody agreement. You got this parent over here where they just go down and get something and bring it to you, and you're caught right in the middle.
So
And
Miss
the only
Shirley,
concern I have is protecting the child.
Miss Shirley, yes. So let me tell you this. So what in a situation where you have one parent, blah blah blah. So you are bound first. So that whatever parent enrolls the child, so you have to follow what that parent's wishes. That the enrolling parent, they are required to fill out a list of people that are authorized to pick the child up. That being said,
Yes.
You cannot legally keep a parent from their child. Now, let me say this. If you have a parent that you have never met that just shows up and claims that they are that child's parent, you are not bound to release the child to that person unless they have a court order. So you can require that they have a court order that says they are authorized, that the release, that they have authorization to have guardianship of that child. But if you don't have a court order and you have no idea who that person is, I would not release that child to that person.
And they will pull you into the middle of a marital
Correct.
And
Correct.
he can't pick these children up anymore. And if he comes here, you call me and I say, oh, I'm so sorry. And may I have the court order?
That's right.
And
That's right.
I said, what the judge?
That's right.
Oh, we hadn't been to court. I said, I'm sorry.
That's right. You have to have a court order to, in any situation like that. Yes, ma'am.
And
Okay. All right. Thank you.
Yes, ma'am. Okay.
Say one thing, sorry, may find this helpful. I do not, as a professional courtesy to my fellow child care providers in Greenwood, Mississippi, I will not hire a experienced child care provider until there has been a year's separation from the former employee. And if they'll talk about North Greenwood Baptist Church, they will sure talk about me. So those are just things to keep in mind. But it's just a professional courtesy. And then they'll tell you, I can bring you these children because they won't bring their classroom. You hire me, I can bring these children. And that is a violation of a business tort as well. So they can be sued for that. So the best thing to do is just ask for a year's separation before you hire the employee and suggest others do the same. But if you don't have a conviction, there's nothing you can do. That is called the U.S. Constitution, and we are proud of it 250 years later.
All right. Do we have anyone else? I'll take one more public comment. But we're after time. So people are hungry. It's lunchtime. So anyone else that would like to make public comment before we adjourn, I'll take one more. Okay. That's, I'm taking that as a no. So listen, thank you everyone, for attending today. I do think this was a good meeting. I think we've got good next steps. We are going to go back. We're going to organize we're going to get members of the two advisory councils to sign up for the work groups for the health and safety topics. You do need to check your email. We will be sending out notice of when these meetings are going to be taking place. We'll send out notification about who is going to be on each council. And in other words, just stay tuned. We will be sending follow-up instructions in the coming weeks. Okay. Thank you all so much for coming, for your participation. Thank you so much to the advisory council members that were here today. I appreciate you all. Y'all have a good rest of your Wednesday and a good rest of your week. Y'all take care. Bye-bye.